Welcome back to the Liberty Perspective. I'm Joe Marshall. Today I'm going to touch on a few things, expand on a few things I've already touched on a little bit. I want to talk to you about the collectivism of the medical freedom movement itself. Shannon Joy is going to be doing another medical freedom summit. You know, she's Dr. Pierre Kory is going to be one of the prominent speakers, I guess, along with Naomi Wolf and I don't know who else. But Dr. Pierre Kory, I don't know. Medical freedom. What's the freedom in Dr. Pierre Kory's medical freedom, right? Where was he in 2020? What was he saying in 2020 when we were going through all this shit? How is he perceived as medical freedom anything? Because he pushed ivermectin? I don't know. But I've got a couple things here that I want to go down through that I've got for you. I want to get right into it here a little bit. Hopefully Minnie P will be okay and she doesn't snap. But what I've got here to kind of show you a little bit is, let me see where we are. There we go. Kind of go down through this a little bit. In 2020, I got, medical freedom, human rights, convolution, Dr. Pierre Kory, medical freedom doctor, or central narrative pusher. In the end, what I've got on Dr. Pierre Kory is just information from his own words. What was he doing in 2020? Was he pushing against the system? Was he bucking the system? Or was he pushing the narrative of the system? And if he was, how so? If he was pushing the narrative system, how so was he doing it? You know. The other thing is when he testified for the George Floyd case, he was he was hired by the Floyd family because they weren't really happy with. Or apparently weren't really happy with the findings in the first autopsy, right? Medical examiners. So I'm going to kind of go down through some of these things and what he was saying in 2020 and how we came and how and what in the bigger picture from a liberty perspective, what Dr. Pierre Kory, medical freedom doctor, was actually doing and pushing the narratives that are targeting our republic for destruction. The revolutionary collectivist narratives, the critical theory, critical race theory narratives that have targeted our republic for destruction. It's not, whether this officer or that officer was guilty or not guilty. That part I don't want to play into. My personal opinions on those don't matter. But what I'm trying to present to you is what Dr. Pierre Kory, medical freedom doctor, has actually been doing, has actually been saying, and the threats they pose to our liberty. They have always posed to our liberty. From a liberty perspective. Okay. Anyways. In 2020, he put this article out. Okay, Dr. Pierre Kory, and it's put this article, ICU doctors. Many more Americans need to wear N95 masks to slow COVID. I don't know what the freedom is in that title. I mean, we're going to read past the title, right? We're going to read past the title. But follow me to see what this guy's actually saying. And think about the memories this brings back to what was actually going on at that time, right? Dr. Pierre Kory and this other guy. We believe that the lack of emphasis placed on the prevention of aerosol droplet transmission is a major contributor to the rising case numbers in many areas of our country. The lack of emphasis placed on the prevention of aerosol droplet transmission is a major contributor to the rising case numbers. Case numbers versus infection numbers, again, in a lot of medical literature, you'll see a difference between case infection rates or case mortality rates and infection mortality rates. They can be different. So I don't know. Is he playing with that kind of shit here with us? I don't know. Case rates being a PCR test or whatever, or a deemed positive test, whether it's a PCR positive or negative, doesn't matter. They were just deeming people positive. Versus infection rate, which would be an infection that has been verified by an examination that you are currently infected with a symptomatic case. I don't know. But anyways, so that's what he says. They want an emphasis placed on the prevention of aerosol droplet transmissions, a major contributor to the rising case numbers in many areas of our country. As intensive care unit specialists in New York City, we are concerned about the rising rates of COVID-19 infection, which may once again overwhelm our hospitals in parts of the United States. All right. The severity, morbidity, and mortality of COVID-19 must be re-emphasized to all. The severity, the morbidity, and mortality of COVID-19 must be re-emphasized to all. Is he pushing the COVID-19 scare narrative or not? Both young and old, as it spares neither. Okay. To avoid catastrophic repeat of the initial surge, we recommend population-wide intervention. A significant increase in the use of N95 masks that may allow for a safer reopening of our U.S. economy. N95 masks. This is back in 2020, okay? There's a lot of the literature, not everybody wasn't abreast on it, so everybody started talking about these masks. Everybody's wearing them. Then they started talking about these N95 masks, and then there was these K95 masks, which were made in China, and there was literature on them that 40% at least of those masks that were being made didn't meet spec on what they were supposed to be meeting, whatever that was, right? But the whole thing about these N95 masks, he's pushing the N95 masks is this, end all be all in preventing the spread of COVID. Well, I had N95 masks. I've had them around, in my landscaping business for dusty projects and stuff like that. I've had them in my skid steer, and I've had them available when I was, doing rock hounding or, or just, York raking or anything in a dusty job site. You want to wear these. You go into a silo or you're working on a farm. You want to wear a dust mask. And that's what they are. But they were N95s. A dust mask is an N95. Technically a respirator. So I wasn't allowed to have any of my employees wear it until 1. OSHA rules till 1. They had to be medically cleared to even wear one. 2, they had to be trained on how to wear one and get it fit tested and all this other stuff and be able to make sure that everything was going to work okay. They had to be trained on wearing it, putting it on, wearing it properly, and removing it properly. But when COVID hit, all that was waived. Just get everybody to wear a mask as much as possible. And in law enforcement too. You wear a mask. They have masks, gas masks or whatever for chemical agents release or whatever, right? Riot control, crowd control, whatever. You have to be medically cleared, 1. 2, you have to be trained. 3, you have to be fit tested to make sure that you're able to get a fit test so that when you got this gas mask on or that you have a seal. The other thing about that seal is that the state doesn't recognize, and most law enforcement don't recognize, or many law enforcement agencies don't recognize the fact that you can even possibly get a seal with a mask if you have a beard. Therefore, a lot of law enforcement agencies mandate that you can't have a mustache past the corner of your mouth. You know? But what the Department of Corrections did was that they allowed officers, they said, well, we'll let you grow a beard if you get the vaccine. Really? But all these people that are out there on the streets, all these people that are out on the streets when they first started locking everybody down and putting all these mask mandates and shit, you couldn't go into stores or nothing without a mask. Whether it was a rag over your freaking, a bandana over your face, a medical mask over your face, or an N95 or KN95, it didn't matter. You know, they were pushing this. But there's all these people with beards. The state doesn't even recognize the fact that they can freaking even get a seal anyway. So it's all bullshit. It was all bullshit right from the freaking start. The other thing I did is I did asbestos removal for a while. You know, it was all the rage in the 80s. You know. But one of the things about asbestos, it's just a rock. It's all it is a rock. But it can break down into fibers, and they're really small, and they use it for insulation. Fire insulation, because rocks don't really burn, right? So they're able to use it for insulation on furnaces, in between layers of furnaces, and around hot plumbing and different stuff like that. They use a lot around boilers and shit. You know, so there was a big business for a while there, and government paid jobs, you know, prevailing wage jobs for removing asbestos in all these schools and everything. So I put myself through asbestos school, and one of the things that you need when you're doing asbestos is these pieces, they float around. They break down into pieces so small, the narrative goes, that breaks down in pieces so small they can float around in the air and still air for 3 days or whatever. And when you breathe them in, they're so small, they pierce the nucleus in your cells, in your lungs, and cause, you know, mutations from that point, because they're piercing the nucleus of your cells and stuff like that. So when they divide, they mutate, cause cancer. Kind of the short story on that one. But the only masks that worked for asbestos were positive air pressure masks. So you had to have a mask on with a battery operated pack that blew air, that sucked in air through HEPA filters. Okay. It sucked in air through there, kept the positive air pressure, which means the air pressure inside the mask was higher than it was outside, so there was nothing going to get in the mask. That was the only way you were going to do it. Sorry about that. But the only way you're going to be able to, with these with the rags on your face and diapers on your face or whatever you're freaking wearing, N95 or not, is that you're going to have air blowing out the sides, you're going to have air blowing up your nose, you're going to have, it's just crazy, right? It's nuts. And these pieces of plexiglass and stuff that they've made everybody freaking, you go to the store and the cash, between you and the cash register was a 2x2 or a 2x3 sheet of freaking plexiglass, right? It's a good thing, you know, COVID doesn't go up and around corners, right? As long as you're standing on the little sticker feety prints that they put on the floor. They told us where to stand, that we needed the socialist distance, right? A significant increase in the use of COVID and N95 masks that may allow for a safer reopening of our U.S. economy. I mean, right from the beginning, this whole thing about masks just didn't make frickin' sense to me. Just because of my experience in the construction industries and law enforcement. It didn't make sense from any of them. You know? Anyways, I've even read studies that go back into the fact on whether doctors in operations wearing masks, whether there was less infection or more infections with or without masks. And the evidence that I remember was pointing to the fact that masks didn't make much, if any, difference at all. I don't know. So, they didn't tell us any of that shit. None of that shit was able to be, put out there for people to be aware of, to consider either. SARS-CoV-2 was thought to be primarily transmissible via large fluid-filled droplets generated by coughing or sneezing. Those droplets usually travel short distances before falling and will not reach another person practicing social distancing or socialist distancing, nor penetrate standard cloth or surgical masks. So as long as they're on the droplets, everybody's safe. As long as you're wearing a cloth or surgical mask, at least, right? However, it has recently been determined that a major mode of transmission of SARS-CoV-2 is via aerosol droplets exhaled by pre-symptomatic, asymptomatic, or symptomatic persons. It's like grease lightning, right? It's like grease lightning. Pre-symptomatic, asymptomatic, and symptomatic persons. It's grease lightning. A little grease for you. These small aerosol particles remain airborne indoors for extended periods, like asbestos, right? And can infect those nearby who inhale them into their lungs. Dr. Pierre, Kory, medical freedom doctor. What can be done to prevent the inhalation of these aerosols and therefore reduce the spread of SARS-CoV-2? The only mask that can prevent aerosol-sized droplet inhalation is an N95. Dr. Pierre, Kory, medical freedom doctor. Should there be a widespread use of N95 masks made by general public? Not necessarily. In Hong Kong, Germany, South Korea, and Taiwan, COVID-19 was brought under control using standard masks. Yeah, just regular masks and cloths, surgical or cloth, often homemade, just something, man. Just show that you're doing something. An approach which relied on the fact that nearly 100% of the citizens wore them in close-quartered public spaces. Excuse me. Too few people are wearing masks. Here is the key. Standard masks, though only partially effective in blocking inhalation of aerosols compared to the near-perfect blocking performance of medical-grade N95 masks used in hospitals, are highly effective at trapping the large droplets that are exhaled by infected people. The key point is, for standard masks to be effective, there needs to be near universal wearing of these masks by all persons when in poorly ventilated, air-circulated, confined indoors, or highly congested outdoor environments. Unfortunately, in some parts of the United States, the proportion of the citizens routinely wearing standard masks in at-risk environments is nowhere near what is required to prevent the spread. Not enough compliance, man. There's not enough. How should individuals protect themselves from infection in areas where near universal indoor mask use is not the norm? In such a situation, the best option is to wear a N95 mask, which is designed to prevent inhalation of more than 99% of all droplets, large or small. So it's 95% effective. The United States has traditionally placed 99% effective, The United States has traditionally placed an emphasis on the rights of individuals. I want you to pay attention to this little area I've got highlighted in blue. The United States has traditionally placed an emphasis on the rights of individuals. We respect the right of, but do not agree with. Oh, I respect your right, but I don't agree with you. Our fellow citizens who choose not to wear a mask. Well, we respect the right that you have the right. We respect the right, but we don't agree with you choosing not to wear one. We also, however, are perplexed as to why responsible people, okay, would choose not to wear a mask given the potential harm, including death, that they could cause their fellow citizens. This is what's called social contract theory, and it's a utilization of what's also known as applied psychology techniques. Applied psychology, and in particular, the doctors were instructed by the CDC. I've done shows on this, and you can go back and you can find them where I get into this a lot more. And the CDC, FDA put out step-by-step instructions for our doctors to leverage the trust that we had in our doctors. They wanted the doctors to leverage that trust to for maximum vaccine uptake and maximum compliance on mask mandates, social distancing, and lockdowns and all this other shit. They wanted the doctors to leverage the trust that we had in them as the general public's most trusted source for medical information. Leverage that, as a word, leverage that trust in order to and utilize applied psychology techniques, what they refer to as motivational interviewing skills. Motivational interviewing skills. Law enforcement will use what they call IPC, interpersonal communications, which are kind of a little bit of applied psychology when you're working with crowds or individuals, or you're trying to get somebody to, comply to a certain direction or go into a certain direction. But what this is right here in blue, that I have: the United States has traditionally placed an emphasis on the rights of the individuals. We respect the right but do not agree with our fellow citizens who choose not to wear a mask. We also, however, are perplexed as to why responsible people, that's just it. That's the social contract theory. They're pushing social contract theory. The responsible person. And he's saying that if you people who don't wear the masks are irresponsible and could cause potential harm, including death, to their fellow citizens. Yeah, Dr. Pierre Kory, medical freedom doctor. That's all collectivist social contract theory. You have the responsibility to comply and wear a mask, even if you have a right not to wear one. But see, that's where the collectivism of human rights comes in. If you're arguing on behalf of a human right for the individual right to not to wear a mask, human rights come from the same collectivism that this whole social contract theory comes from. If you're arguing on behalf of your natural, endowed by our Creator, individual rights and liberty, you have an individual right to not wear that mask. As he says, we traditionally, place emphasis on the rights of individuals. But a responsible person exercising human rights and not the egocentric, me first, greedy, individualist rights. Human rights is where you don't have a right to not wear a mask if that's what the central planners has deemed what's best for the collective. Individual human rights are still collectivist rights, and they exist only so long as they serve the needs of the planners and it further what the planners have deemed what's best for the collective. And just them four lines right there, he's saying a lot. He's injecting the whole collectivism of social contract theory. And the other part of that social contract theory too is the sanctioned bullying that comes with you've got the virtue signaling of everybody wearing a mask, and then if you get as many people as you can to wear the mask, And then you get people out there that will start bullying and police it. That, if you can get the inmates to police themselves, you know what I mean? It makes the prison guard's job a little easier. You know what I mean? And basically, that's what they did to us. They did to the general population outside prisons, whole of our society. They got the inmates to police themselves. That's what they did to us with this shit. And you get people to go up to you and bully. Well, why are you not wearing a mask, man? What makes you think you have a right to spread that shit around and make me sick? All right. Well, if you're wearing a mask, what the hell difference does it make, right? If they work so fucking good. Sorry about my language. If they work so freaking good, right? Same with a vaccine. You don't want me to get vaccinated? You want to get vaccinated? Go out there and get vaccinated. If the vaccines freaking work, what difference does it make if I'm vaccinated or not, right? I don't know. Not the point. You got the responsibility, man. We need herd immunity, man. Those who protect themselves with an N95 mask would be able to safely participate in many activities involving groups of people. Oh, so he's pushing that narrative. At-risk social gatherings and entertainment venues would be appropriate targets for routine N95 use if universal standard mask wearing is not a precondition for entry. Super spreader events are proved deadly. Super spreader events? The scientific and media publications describing super spreader events provide some of the most damning evidence of the risks of congregating without universal mask wearing. The choir practice, where one singer infected 52 of the other 60 attendees. Aerosol transmission. The pre-symptomatic 29-year-old man who infected 102 people during visits to multiple crowded nightclubs. Aerosol transmission. The pre-symptomatic 29-year-old who infected 102 people. Dr. Pierre, Kory, medical freedom doctor. The challenge we face as a country, that is, we do not yet have sufficient N95 masks, even for healthcare workers, let alone for widespread distribution. It's unclear to us why this is the case, as it is well within the immense industrial capacity of the United States to ramp up national production of these simple, low-tech safety devices. Our current infection control strategies are unlikely to succeed. The lockdown approach employed by the Chinese government to rid Wuhan of the virus is not feasible in an open democracy of our country. In the open democracy of our country. We're not a democracy. We're especially not an open democracy. Our founders rejected democracy for a reason. Okay, that's not to say our founders rejected democracy for a reason. Madison explains in Federalist 10 a little bit, because they're volatile. They're known to be volatile and short-lived, where republics are more steady. But here, the thing is, why do we have a republic? And really short, our Constitution ordains a republic, and what was set up to be really quick is like a submarine or a ship that's broke off into sections, okay? They have sections. So if a fire or a leak or a torpedo hit or something, right, hits one section, the fire or the leak doesn't spread through the other sections. They can section it off. Or it leaks slowly through that, you know? They slow it down so maybe they can get rescued or maybe even get the ship back to shore before it sinks, right? To get repaired. But democracy, open democracy, what that does is it removes all those sections, those firewalls, because you have village, you have town, you have local governments, you have village and city. You have local governments there. Then you have the towns that those villages and cities are in. Then you have the counties that those towns and villages and cities are in. Then you have states, and then you have the federal government, right? So you've got sections. where like Madison was explained, he called it factions. Faction, which would be any particular faction of people that would be a threat to the people's liberty, could happen in one place or this place or that place, but the firewalls of the republic would keep it kind of to in one section and wouldn't spread like unabated across the whole of the country, sea to shining sea. But that's what the progressive, in the progressive era, there was things that came up like populism. That's what populism does. That's what pragmatism does. These political philosophies, nationalism does. There are political philosophies that come out of the progressive era. I don't know nationalism, but pragmatism and populism came out of the progressive area specifically, which was like the early 1800s up until like the mid 1950s or 60s or whatever, right? Progressive era policies and politics. Populism was designed to make as many things of natural interest or of national concern, or nationalize as many things as you possibly can instead of localizing things. You know, so it becomes a threat to the country if you can make it popular. That's what populism does. It skirts. It's a philosophy to skirt our republic, to skirt the firewalls of our republic. Pragmatism is the same thing, where you come out there was, you know, don't let perfect be the enemy of good shit. That, you know, Naomi Wolf and her husband Brian O'Shea and a lot of the nationalist right were pushing, because they don't give a shit about our republic. They're nationalists. Nationalists don't give a shit. They're about, you know, our limited constitution. And if you are a nationalist who wants to preserve our constitution, you're in self-conflict. Your politics are self-conflicting. Nationalism is a socialism. Populism is a progressive policy, collectivist policy to skirt our republic, to skirt the firewalls of our republic. I just wanted to kind of explain that out to you. When he's calling for open democracy here, now Marxists have always wanted an open democracy. They're fighting for an open democracy for the same reasons that our founders rejected open democracy. Where Marxists have targeted, collectivism has targeted our society. America is founded for destruction. That's what communism does. The Communist Manifesto is about. They present the dominant society targeted for destruction in terms of the Communist Manifesto in the oppressor versus oppressed context of the Communist Manifesto. And that's what critical theory does, critical race theory does. And, you know, a lot of these philosophies that, you know, accuse America of its inherent whiteness and white supremacy and the structural white supremacy, the structural racism, they're presenting our society to as many people as they can from the perspective of the revolution against it in the oppressor versus oppressed context of the Communist Manifesto. And the other thing about Marx is he called for a dictatorship of the proletariat. From a revolutionary communist perspective, they're looking at our country and they're saying, well, right now, you know, our country's under the dictatorship of capitalism, is under the dictatorship of, you know, white supremacy, or under the dictatorship of, you know, whiteness of America, or whatever that they're saying, okay? Under the exploitation of capitalism. That's what we're under the dictatorship now of. But we need a dictatorship of the proletariat. You know, the rise up, you know what I mean? And the oppressed versus oppressor context of, again, the Communist Manifesto. Marx's dictatorship of the dictatorship of the proletariat can't really come to fruition if our republic and the firewalls of our republic are intact. They want that dictatorship of the proletariat to ignite and burn across America, sea to shining sea, unobstructed. Can't really happen if the firewalls of our republic are still intact. So we've got a lot of these different progressive, collectivist, Marxist. Marxism is just another collectivism. You know, just another one. That's all it is. Just want to point that out. And what we're talking about here, Dr. Pierre Kory, the lockdown approach employed by the Chinese government would rid to rid Wuhan of the virus is not feasible in the open democracy of our country. Now, I don't know. But he's presenting his argument in the context that a Marxist, a doctrinaire Marxist would. Wittingly or unwittingly, that's what he's doing. Waiting for herd immunity would result in widespread death and disability while again overwhelming our hospitals. Medical freedom doctor, Dr. Pierre Kory. While we wait for a vaccine, while we eagerly wait for a vaccine, okay, an effective cure, or even the unlikely event that all 50 states will pass public health laws that mandate universal mask wearing in all indoor public places, we could have a national initiative to ramp up production of N95 masks so that all Americans have access to this level of protection. Medical freedom doctor, Dr. Pierre Kory. Anyways, what kind of a pro-liberty, pro-republic, pro-freedom person of any kind would have said those things in the way he said them? I don't see any liberty or freedom in any of that. He's pushing a narrative. What part of the narrative, what part of the main narrative coming down from COVID was he not pushing in that? Asymptomatic spread, super spreader events even. I don't see the medical freedom. I don't see the freedom there. But anyways, what kind of a pro-liberty, pro-republic, pro-freedom person of any kind, be it medical or otherwise, would ever call for more of the centralized fascism that directly resulted in the tyranny of COVID on a multitude of levels? Of the public-private partnerships, the fascism of public-private partnerships. Now, Mussolini called public-private partnerships fascism, right? He said that's what fascism is, right? Well, unless Mussolini doesn't know what fascism is. But what I'm getting at here is anybody who was trying to preserve our republic, anybody that was trying to preserve liberty, actual, real liberty, individual rights and liberty, would they be pushing for the collectivism, the fascist collectivism, of centrally planned collectivism of public-private partnerships, and that led to the financial incentivization of compliance to a centrally planned protocol for COVID, the no treatment protocol, and what treatments they were allowed to do. This is the centrally planned public-private protocol that Dr. Pierre Kory said that, didn't allow him to push his ivermectin. Yet this is the same guy who called for more public-private partnerships. I got him right here. Let me see if I can't. Okay.
And hydroxychloroquine, the drug of fringe, quack, right-wing anti-vaxxers. So what's the way forward from here? We need to create a framework to test off-patent and off-label drugs and model their clinical benefits and cost savings. A public-private partnership of diverse, independent, unconflicted stakeholders accountable to Congress could conduct sustained, independent, systematic studies of repurposed drugs that would complement FDA review, clinical practice, and the role of natural immunity in health.
That's Dr. Pierre Kory, medical freedom doctor. But he called for more public-private partnerships of unconflicted stakeholders. not only is he calling for more public-private partnerships, he's doing it in the universal world socialist language of the United Nations of human rights. Stakeholders. That's a word born of world socialist doctrine. Just saying, wittingly or unwittingly. Not only is he speaking and advocating the world socialism, he's doing it in their language. Dr. Kory, I see him talk about slave speak. There's some more of your slave speak right there. Stakeholders. Unconflicted stakeholders. If you've got stakeholders running your ship for you, then you've got a socialist program running your ship for you. It's just what it is. Now we're going to get into George Floyd a little bit and what Dr. Pierre Kory's involvement in that case. But what I've got here is to kind of bring this in. There's an article that came out. There's an article that came out in October of 23, and then it was updated in January of 2024. That kind of shows you, it brings to light a little bit the important part that Dr. Pierre Kory played in continuing the critical theory accusatory against America's structural racism. Okay, he wasn't just testifying on behalf of the Floyd family to counter a previous medical examiner's findings. There's more to it than that. He's pushing a narrative straight out of revolutionary collectivist doctrine. He's pushing that anti-American doctrine of critical theory, critical race theory, and the accusatory of structural whiteness, structural white supremacy, structural violence against oppressed, again, in the oppressed versus oppressed context of the Communist Manifesto. It's just what's doing. And I'm going to introduce it with this article here that was written in 2023, just recently, okay? But the first thing you see when you click onto this article is this painting of George Floyd. Okay, that's the article. All right. It was in, but this guy Lau Pan, all right, the painting that he does that we're looking at, the first thing that we see is a little bit with that. Just the first thing we're seeing, I just want you to say in 2015, UN member states agreed to 17 global sustainable development goals, United Nations global sustainable development goals, to end poverty, protect the planet, and ensure prosperity for all. This person's work contributes towards the following sustainable goals. So the guy who painted this picture, the first thing you're seeing in this picture is a painting by a guy whose work his work contributes towards the following sustainable development goals. This is what they're saying. Okay. And there it is. There's the sustainable development goals. Expertise related UN sustainable development goals. His work contributes towards Sustainable Development Goals number 2, zero hunger. Number 3, food, health, and well-being. Number 12, responsible consumption and production. Number 13, climate action. And number 15, life on land. Those are the particular sustainable, it's the world socialism of these particular sustainable development goals that this guy Lau Pan's work and the painting in this article contribute towards pushing. Just wanted you to see that right off the bat too. So the first thing you do as soon as you start looking, and you're being steered into the world socialism of sustainable development goals, which critical theory and critical race theory are also part of. They're derived from it, and all the redistributive justice that needs to happen because of it, right? Well, anyways, I want to read you this article a little bit here, or some highlights out of this article from Healing Truths in the UK, I guess. But anyways, Although George Floyd died over 3 years ago on May 25th, 2020, interest in the case has been renewed. Yeah. Despite the conviction of police officer Derek Chauvin for his murder on April 20th, 2021, may have suspected that Floyd died not from police restraint, but from an overdose of fentanyl, an opiate that is far more dangerous than heroin. And that was found in his system at high levels. So they're saying that it was at high levels and it was in his system. But despite the conviction of police officer Derek Chauvin on April 20th, 2021, many have suspected that Floyd died not from police restraint, but from an overdose of fentanyl, an opiate that is far more dangerous than heroin. In a recent deposition for a separate case, Amy Sweezy, a Hennepin County prosecutor, refers to events around George Floyd's death. She quotes Hennepin County medical examiner Dr. Andrew Baker, who performed an autopsy on George Floyd, as saying, quote, "There were no medical findings that showed any injury to the vital structures of Mr. Floyd's neck. There were no medical indications of asphyxia or strangulation." Amy, what happens when the actual evidence doesn't match up with the public narrative that everyone's already decided on? This is a kind of case that ends careers. A lot of tension going on here. The public is demanding a certain finding, while pushing that there probably isn't going to be that particular finding. I don't know. At face value, these comments suggest a wrongful conviction on the part of Chauvin, right? Or the other officers as well. These comments suggest a wrongful conviction took place and that there was an effort to deliver to the public the conviction they demanded. And that these guys were all just thrown under the bus to get that conviction. These comments have, the fall of Minneapolis kind of put that out there, right? These comments that have been taken by Tucker Carlson and the Spectator magazine, Carlson's post alone has been viewed at the time of writing over 21 million times. To be clear, the Spectator article alleges that Dr. Baker, under pressure, reworded his report not to lie, but to be ambiguous enough to be misunderstood. However, Dr. Baker's views are not the only expert opinion in this case. Enter medical freedom doctor, Dr. Pierre Kory. Shortly after Floyd's death in 2020, Dr. Pierre Kory was to give expert medical testimony in the George Floyd civil, not criminal case. Prior to the case, Dr. Kory had years of experience in the ICU and pulmonary wards of a busy hospital, and describes himself as having taken care of many dozens of opioid overdoses in the ICU. So he's describes himself as a person who's taken care of many dozens of opioid overdoses. As he comments, his role in the civil case was to give his expert opinion as to the approximate cause of death, not to judge Floyd nor the protests that arose following these events. As to the officers' intentions and motivations, only they themselves truly know. I've got this little mark here that we'll get to after that about him describing himself as a person who has taken care of many dozens of opioid overdoses. Right. Also, the other thing to point out here is as he comments, his role in the civil case was to give his expert opinion as to the approximate cause of death, not to judge Floyd or the protesters. All right. Dr. Kory gave his full report on June 9th, 2020, in which he concluded that Floyd died neither of a fentanyl overdose nor just from a knee to his neck. So there's a lot more going on here than just a knee to his neck. Right? So what did kill Floyd? In Dr. Kory's expert opinion, Floyd's death was due to a combination of factors. The position he was restrained in, known as a prone restraint, the weight of 3 officers pinning him down, his inability to get sufficient breath over many minutes, and incompetent medical attention when the ambulance did arrive. So it's not just these officers. It's not just law enforcement, and it also includes the other part of the system, which is our whole racist medical paramedic system, right? The prone restraint position Floyd was in had him face down with the chest against a hard surface, which I'm going to show you a demonstration of this in a minute from this article's own source. With his chest against a hard surface and his hand cuffed behind his back so that he was unable to use them to create space for breathing. Chauvin's knee on Floyd's neck did not fully occlude his windpipe, close it off, at least not at any time that Floyd was able to speak. Hence, there was no injury to his neck. However, the back of the windpipe is soft tissue, so occlusion can occur without fracture. So, in other words, they could have done it and then have it not show up, and nobody would know. Not the medical examiner would have no idea. But in Dr. Kory's assessment, the more likely cause of death was that Floyd had nearly the full body weight of 2 officers pressing on his neck, upper, mid, and lower back, compressing his chest and otherwise restricting his breathing, with a 3rd officer restraining his legs so that he could not adjust his position to enable him to breathe. So he wasn't kicking at the officers, he was just trying to breathe, I guess. I don't know. I'm not even trying to retry this case or anything. That's not the idea what I'm doing here. I'm just trying to present to you how Dr. Kory has been injected into this case. And the subject matter surrounding Dr. Pierre Kory, Medical Freedom Doctor's expert presentation in this case. Right? Expert testimony in this case. Prone restraint is known to be a dangerous position the reason many agencies have restricted or prohibited its use, especially for long periods of time. Yeah, it's was to prevent what's known as positional asphyxia. When you have to take somebody down who's violent, when you have to take somebody down who's resisting arrest, which you can't say George Floyd wasn't resisting arrest, or resisting direction, or refusing direction, lawful direction, okay? It's positional asphyxia. You get somebody down and you have them down there and you handcuff them to keep him safe from you, safe from himself, safe from, and also the arresting officer safe. It's positional asphyxia. Yeah, law enforcement officers, we were in the Department of Corrections. We're also made aware of these things that we need to be aware of when in use of force. Right? It is objected that Floyd complained not being able to breathe before he was put into restraints, which he was, right? Which he did. Again, Dr. Kory explains this is dyspnea. Dyspnea? I don't know how you say it but the feeling of being able to unbreathe. However, opiate overdose cases do not complain of their inability to breathe. They don't complain of their inability to breathe. But he was on opioids. He was complaining that he couldn't breathe, right? I mean, just saying. Instead, opiate overdose victims first descend into a sleep-like, high pleasurable state and then progress into unconscious. Their breathing slows, stops, and then they arrest. After they go into these things. There's another thing I'm going to get to in a minute. We'll talk a little bit more on that. Complaints of dyspnea. Dyspnea? I don't know. However, may be symptomatic of a panic attack, which it seems Floyd was having. So maybe that's why he was resisting arrest. Is it a panic attack? They're saying it was a panic attack, which it seems Floyd was having. What about the fentanyl in the system? Dr. Kory states about the fentanyl in the system, quote, chronic opioid users, which Mr. Floyd was, can and do often develop significant levels of physiologic tolerance to opioids. Thus, the absolute level measured in a chronic user is not accurately predictive of the degree of intoxication. The absolute level measured in a chronic user is not actually predictive of the degree of intoxication or death. When you get pulled over to DWI, whether it's your first time drinking and your tolerance is low, or you're a guy who's been drinking a lot and is quite tolerant of massive amounts of alcohol, regardless of the blood level, at a certain point, you're intoxicated, whether you're actually intoxicated or not, or feel the intoxication or not. You're still intoxicated. But what they're saying here with opioids, that doesn't apply. It doesn't apply here. Okay? Yeah, it doesn't apply here. Chronic opioid users, which Floyd was, can and do often develop significant levels of physiological tolerance to opiates. Thus, the absolute level measured in a chronic user is not accurately predictive of the degree of intoxication. So it doesn't matter what your blood level is. You can't predict it. You can't predict your level of intoxication, but they do it with DWIs. However, I agree that if Mr. Floyd's level was found in an opioid naive user, right, somebody who has never done it before, or a first-time user, it would almost certainly predict unconsciousness and or risk of death. In anticipation of questions about Dr. Kory's impartiality, since he was hired by Floyd's family's lawyers, he states, quote, I have done plaintiff's work before. On 2 occasions, I arrived at a conclusion that it did not support the finding of malpractice of the accused physician. I was quickly dropped from the case both times. Note that was after being paid for my review work. Thus, payment is not predictive on my conclusion. So this is conflict of interest waiver, right? Another aspect of this case is that even after the ambulance crew arrived, the paramedics clearly checked Floyd's pulse, but then failed to administer treatment. It was another 1 minute, 39 seconds before Floyd disappeared into the ambulance to receive treatment, time that may have been critical. Kory comments that even if a pulse is absent, CPR should still be administered at the earliest moment possible and may save a patient's life. So he's armchair quarterback in the scene, and what the paramedics did or didn't do. Summary. Notwithstanding the pressure others have reported they were under to deliver a politically desired verdict, I believe the evidence presented by Dr. Kory, who was under no such pressure, really, presents the strongest case and answers all objections to the contrary. As Dr. Kory and the jury concluded, Floyd's death was a result of police brutality. Wasn't a result of an abuse of force by these particular officers or certain officers or even Minneapolis Police Department, but police brutality. The failure of the paramedics to intervene swiftly may also have played a role. Right? According to Dr. Pierre, Kory, medical freedom doctor. Anyways, he lists some of these sources that he had, and he's got this one source here, which I wanted to show you. Oh, I got that video here. No, hang on a second. I'm going to go here. Okay, now probably about 8.
Can't fit in those jeans? Be careful
Gonna
with
have
beans.
to get by these.
All right, let's talk about beans, that musical fruit. The more you eat.
Gonna have to get
Buy
by
one,
these ads.
get 2 free ends soon. There's still time. Act now to secure your family.
Hi, my name is John Dale Dunn. I'm the medical officer for the Brown County Sheriff Vance Hill. I've been medical officer for 4 different sheriffs over a period of 30 years. I've been in the practice of medicine for 50 years. I've been a lawyer for a little more than 40 years. I've been an emergency physician during most of my physician career, more than 40 years. I did family practice for a while. And because of my background and because of my current job as medical officer for the Brown County Sheriff, I've been very interested in the matter of Derek Chauvin's trial, but also the death of George Floyd. As you can imagine, there are plenty of people who are arrested and incarcerated, even in a county of our size, which is right around 40,000. So I've studied the case. We're almost on the first anniversary of Mr. Floyd, his death, May 25th of 2020. I've looked at the autopsy as soon as it was available. I've looked at some of the arguments and commentary. I've watched the trial and the developments around the case. And so what I decided to do was an experiment to deal with the question of what killed Mr. Floyd, and did the prone restraint that was performed by Officer, well, I guess he was a Sergeant, Derek Chauvin, actually was it what killed Mr. Floyd? In order to do that, I did some video, and I selected 2 officers from the corrections officers here at the Brown County Jail. The one sitting right next to me is Officer Colton. Did his left knee on your shoulder create any problems with your shoulder?
No, not really.
During the period of time that you were under the restraint and on your stomach on the floor, which was a 10-minute period, was there any point in time when you felt short of breath?
No, sir.
Okay. And at any point during the restraint period, did you feel like you needed to get out from underneath Corporal Williamson's knee in order to be able to breathe?
No, sir.
All right. Engaged in the
I want to show you a couple parts of this video. I didn't select this video. This is a video listed in the sources of that article I just read about how Dr. Pierre Kory's testimony has brought new light and new interest into the George Floyd case. So I just this guy, Dr. John Dale Dunn, okay, he's a lawyer and a doctor. So he's going to have these officers doing demonstration, and he's going to put a pulse ox on there, showing that the whole while they using the same takedown, the prone position takedown that Chauvin used. Okay, he's going to show how a demonstration between two officers. He's going to time it. Okay, there's only one guy on him this time. There isn't two officers on him, but there's one officer on him. And he's trying to recreate the video that he saw the arresting scene with Floyd and Chauvin. And I just want to have you watch a couple minutes of this. Again, I didn't pick this video; it was in the sources that they picked.
Restraint applied to Officer Ashby. You'll see here that I have a clock that I intended to use as a way to make sure that you know that we're not cheating and we're going to go 10 minutes. And I have no problems with worrying about the condition of Mr. Ashby, and we'll be watching him and making sure that he'll be okay during this period of time that he's going to be in the prone restraint. Go ahead and lay down there. Head that way, towards the camera. There we go. What we're going to try to do is reproduce the situation that George Floyd was in. He had his head to the left during all the time that I watched it on the video, and he was on his stomach, and what the corporal is going to do is kneel down with his right knee on the ground and put his left knee on the shoulder of the subject, get it up close to the neck so that you reproduce what happened at the time of the George Floyd incident, and that's what we're going to start. The clock is running. It's starting with the big hand on the 5. So you can turn off the video and we'll time-lapse this, and then we'll pick it up again in 10 minutes. We're at 10 minutes. And Mr. Ashby has had this pulse oximetry on his finger from about 5 minutes on, because I wanted to be able to track his pulse oximetry to see what it was doing after he'd already been under the prone position restraint for 5 minutes. And let's take a look at what he's got. Can we release Mr. Ashby? Oh. Well, actually, let's just take I'll tell you, here's his pulse oximetry during the 10-minute period has never gone below 97, and right now it's 98, and his pulse is 83. We'll just leave it on while we take off the cuffs so that you'll see it. Because I know you might say, well, you read it to me, but I'm not sure that it's true. Leave it on your finger, Mr. Ashby. All right, that is proof. That is an experiment that proves that the theories that were presented by doctors at the Chauvin trial have no support in science, in good science. And I'll explain a little bit why. I'll also explain to you a little bit about what actually happened to Mr. Floyd. All right, you guys are dismissed. You can go back to work if you want. So, here's the deal.
As you were.
George Floyd was high on a significant amount of fentanyl that he had hooped, which means that he put it in his anal canal so it would be absorbed quicker and give him a bigger rush. He also had methamphetamine on board, which is a stimulant. Fentanyl.
Anybody heard that one before? When I was watching this video, I clicked on this video just to see what this, as a source, what the video was. When I heard that he suitcased that stuff, he calls it hooping. We call it suitcasing. You put your drugs or whatever to in your anus. Well, suitcasing is just to travel, to bring it in and out of prisons or whatever, so you don't get frisked and find it. But hooping is actually when you're trying to do it to catch a buzz. I don't know, maybe it's like a suppository, right?
Is like heroin it makes people go to sleep, get lethargic. But in certain situations, particularly if an individual uses fentanyl a lot, and Mr. Floyd apparently did because he could tolerate the amount that he had in his system, it will make them euphoric, and it will make them subject to what we might call excitement and agitation, because they get confused. They're easily confused because they're intoxicated. And so the fentanyl essentially added to what amounted to the agitation and excitement and delirium that came from the arrest situation and Mr. Floyd's decision to be uncooperative. If he's physically active, it also increases the amount of what I would call excitement in his system as when compared to and added to the effect of the fentanyl. And then what you've got is what I consider to be a very important thing. He had methamphetamine on board. Now, all of those things might be enough to cause even a healthy man to have a cardiac arrhythmia, which is a sudden cardiac change in rhythm so that it doesn't beat blood and it doesn't supply blood to your brain, and you just die. And you die within a very short period of time. But here's the other part.
And listen to what he says here. This is another aspect of what was going on that I don't think a lot of people are aware of either.
Autopsy shows that not only was there no evidence of injury to Mr. Floyd's neck, his chest, his airways was fine, his lungs were okay. There wasn't anything about his lungs that were commented on by the autopsy that said that there was any disease in his lungs or any excess fluid. In fact, their comment was there's no excess fluid in his chest cavity or his lungs. So the question goes, did he have a medical problem that would have increased his risk for having a sudden cardiac arrhythmia and die from it? Well, it just so happens that he did. He had severe, not mild, not a little bit, he had severe coronary artery disease in all the major coronary arteries of his heart. That
All
means that
the
his
major
heart
coronary arteries.
was working under a situation where the coronary arteries did not supply as much blood to his heart muscle, and it made the heart muscle prone to being irritable. The second thing that added to his risk, because the heart is irritable, you can have a cardiac arrhythmia and die from it, is he had hypertensive heart disease, which he may have had from the time he was young. It may be that it was aggravated by his methamphetamine use, but what it did was it produced a hard, larger heart that's subject to arrhythmias. So you've got coronary artery disease, you've got fentanyl on board, you've got methamphetamine on board, and you've got hypertensive heart disease, all of which increase the risk of cardiac arrhythmia, and that's what happened to George Floyd. George Floyd died suddenly in the restraint position, not because he was suffocated. Remember, Mr. Ashby's pulse oximetry was the same at the beginning as it was at the end, in spite of 10 minutes of the prone restraint being applied to his back, his left shoulder, and his neck. So, when it comes down to it, if you believe what the doctors say killed George Floyd, you're ignoring the evidence, and they're telling you a big tale. Think about that. Now, there are a couple.
Yeah, think about that. Everything that Dr. Pierre Kory is testifying to is in direct conflict, direct contrast with what that doctor and lawyer just presented, with the demonstration from officers demonstrating the same prone restraint. And he was just laying there. He wasn't trying to move his legs or nothing. Again, I didn't pick that video out. That came from the article that we just read, and how Dr. Pierre, Kory, and the jury concluded Floyd's death was a result of police brutality. Okay. Now, up here, and we went over here a little bit earlier, is that, Kory explains that this dyspnea, the feeling of being unable to breathe, however, opiate overdose cases do not complain of their inability to breathe. That's going to come up again. But he said the opioid overdose victims first descend into a sleep-like, highly pleasurable state and then progress into unconsciousness. Their breathing slows. Okay, this is going down to the double one. We'll address that one first. Now, Cleveland Clinic. I went to the Cleveland Clinic. I said, well, geez, what is an opioid? Look it up. Like, what is an opioid overdose? He's saying that they don't complain. Right? He's saying up here, opioid overdose victims first descend into a sleep, highly pleasurable state, and then progress into unconsciousness. Their breathing slows, stops, and then they arrest. They do not complain of their inability to breathe. So while they're consciousness, they don't have a difficulty to breathe. I don't know. Is it only after they're unconscious that they have a difficulty to breathe? I don't know. But so we're going to go down here. Per the Cleveland Clinic. Okay, what is an opioid overdose? What is an opioid overdose? An opioid overdose happens when opioids excessively stimulate the part of your brain that regulates breathing. This leads to respiratory depression, ineffective breathing, and can cause death if it isn't treated in time. So whether there's an officer on your back or not, that happens, right? Also from the Cleveland Clinic, drug overdose is leading cause of accidental death in the United States, with opioids being the most common cause. The U.S. Centers for Disease Control and Prevention estimates that there are more than 1,000 emergency department visits daily are related to opioid use, and that there are about 91 opioid overdose deaths every day in the U.S. Mark Kulak from Housatonic might have different numbers in this, but this is particularly, he might show even more. But I just found it curious that this same article in the Cleveland Clinic here put this out in there in conjunction with what an opioid overdose death is, that it affects your part of your brain, whether there's an officer on your back or not, that regulates breathing. Prescription opioids are involved with 25% of all opioid overdose deaths. Non-prescription opioids account for 75% of opioid overdose deaths, according to the Cleveland Clinic. Right? Okay. From that point, this is what we got from the Federal Trade Communications Connect 2. Communications Commission, FCC, and their Connect to Health. I got another little thing off, a little side shoot off of this. This is all kind of related to this as we're going down through. Focus on broadband opioids. The opioid crisis has been ravaging communities and families across the United States for the past decade. In 2017, the opioid crisis was declared a public health emergency under Section 319 of the Public Health Services Act. And that declaration was renewed most recently in June of 2024. The crisis claims more than 220 lives per day. This is 91 opioid overdose deaths a day. This is saying that This is saying that the crisis claims more than 220 lives per day. Evidence also suggests that the impacts of opioid crisis have been exacerbated during COVID-19 public health emergency, with significant increases in alcohol and substance misuse and worsening mental health. According to the Center for Disease Control and Prevention, more than 645,000 people in the United States have died from overdoses involving opioids since the epidemic began. when there's talking about like in 2017 maybe, I don't know. The number of annual opioid overdose deaths remains more than 6 times higher than it was in 1999. There were approximately 81,806 opioid overdose deaths in 2022 alone. And 90% involved synthetic opioids other than methadone. So that would be fentanyl with one of them, right? Regarding opioid crisis being used once again, this time to push government broadband and or connect to health. Yeah, notice that they got this connect to health and they're talking about this opioid and it's a focus on broadband and opioids. So when we're reading and we're getting this data, these stats out of this article, which is actually kind of a push for broadband subsidies and subsidies by government, because what they're doing here, check this out. Of course, opioid overdoses may also be non-fatal. These non-fatal opioid doses place significant burdens on the government, health systems, communities, and families, and may disproportionately affect rural and underserved areas. There's your underserved, your disadvantaged areas again, pushing the narrative. For example, there were nearly 290,000 hospitalizations and emergency department visits related to opioid poisonings in 2016. Most of these hospitalizations and emergency visits were paid for by Medicare, Medicaid, or uninsured, or the uninsured. Rural counties may experience resource shortages or limited economic opportunities that negatively affect access to health and care services and health outcomes. We're getting this data and they're utilizing this data only so long as it's pushing a narrative to further the progressive collectivism of universal health care and wait for it, electronic medical records. The utilization of electronic medical records. And, you know, a couple years ago, we had companies coming through here putting all these high these cables in here where you have the glass tubes in them and stuff. Fiber optics. Yeah, I had to ask my wife. I'm too dumb to remember this shit. But they had all new fiber optics cable. Verizon came through, Spectrum came through, and all that's all done by government subsidies and shit. So what they were doing is they're pushing all this shit here. The concept model also recognizes the evolving nature of the opioid crisis. The CDC characterizes the crisis in 3 distinct waves identified in primary type of opioid driving the spike in overdose mortality. Driving the spike in overdose mortality. Wave 1, 1990s. The crisis began in 1990s with a first wave of deaths due to a rise in overdose involving prescription opioids. The second wave in 2010 with a spike in heroin and involved deaths. In 2013 to present, the present wave is defined as a rapid increase in deaths due to synthetic opioids other than methadone, including fentanyl analogs, and tramadol. Since 2013, between 2021 and 2022, synthetic opioid deaths increased by 4% and now account for 90% of opioid-involved deaths. Synthetic opioids now count in 21 and 2022 accounts for 90% of opioid-involved deaths. Regarding the need for subsidized broadband and centralized utilization electronic health records. Okay, so this is where I'm getting at. Why broadband is important. Meaningfully using electronic health records is many of the capabilities of health IT. Okay. Such as telehealth and the electronic exchange of healthcare information require broadband capability. Who you will need to contact to obtain broadband access will depend on your needs and the technology available in your community. So what they're doing is they're giving up these stats on opioids. As you're not going to find it unless you go to some place where they're using those stats to push something that they're looking for to further the use of, in this case, electronic health records, the utilization of electronic health records, and they need those fiber optics. They need that broadband, fast internet in order to be able to utilize this shit, right? And they also say that lower opioid deaths are associated with the use of telehealth or some shit like that too. So this is all comes down out of what Dr. Pierre Kory is up here talking about, what is or what isn't an opioid death, right? Opioid overdose victims first descend into a sleep-like, highly pleasurable state and then progress into unconsciousness. Their breathing slow stops and then they arrest. However, opioid overdose cases do not complain of their inability to breathe, so they don't have an inability to breathe unless they're unconscious. I don't know. That's what I was kind of getting at down here with this. You know, and then we go to the NH. What is fentanyl? Okay. Fentanyl is a powerful synthetic opioid and that was what George Floyd had in his system, is a powerful synthetic opioid that is similar to morphine but 50 to 100 times more potent. Fentanyl's effects. Okay? They list all these different things down here. Problems breathing. Dr. Pierre Kory says they don't have problems breathing while they're awake anyways. Fentanyl, common questions. When we go to my health in Alberta, Canada, can using fentanyl poison me? Early signs of fentanyl poisoning may include trouble breathing. And it could even sound like snoring. Was George Floyd snoring? But he had trouble breathing. He was complaining about not trouble. He's also, they showed him in videos too, and other videos too, when he was arrested or police came to the scene where he was at, complained about not being able to breathe. Kind of as a routine, as MO, you know. American Lung Association, underlining respiratory diseases at the heart of opioid deaths. Oh, wait a minute. Finish this up. According to Canada, it says early signs of fentanyl poisoning may include trouble breathing. The most dangerous side effect of fentanyl is that it can cause you to stop breathing, whether you've got 1, 2, or 3 cops on your back, right? Doesn't say anything about it. You don't need 1, 2, or 3 cops on your back for that to happen. American Lung Association, underlying respiratory diseases at the heart of opioid deaths. Okay. Misuse of prescription or synthetic opioids can suppress breathing and block air from entering the lungs, cop or no cop on your back, leading to hypoxia and suffocation. It can also exacerbate asthma. Symptoms. Having an existing lung disease is a leading indicator for death in an opioid overdose. Having an existing lung disease is a leading indicator for death in an opioid overdose, which can be exacerbated by asthma, or can exacerbate asthma. Due to decreased lung capacity, individuals who have an existing lung disease, such as asthma, are more likely to die from an overdose than their counterparts without existing lung disease. Per Floyd's family attorney, Ben Crump, per his own attorney, Ben Crump, he had asthma. George Floyd had asthma. He had a heart condition. All these things that are irrelevant when they were living, breathing, walking, talking just fine until the police accosted them. He had asthma. He had a heart condition. All these things that are irrelevant when they were living, breathing, walking, talking just fine until police accosted him. Other apparently irrelevant realities from George Floyd medical condition, from AP News, injuries. Okay, from AP News, injuries. No life-threatening injuries were identified. The report says that though trauma to the face, elbows, and hands consistent with being handcuffed are noted and resisting arrest. Finding no major bruises or damage to the muscles, cartilage, or bones in the neck doesn't in any way mean that asphyxia didn't occur. Just that there were no signs of that on the body, Davis said. Heart disease. Several of Floyd's key heart arteries were severely narrowed. Evidence, as that other doctor in that video showed, right? Then they're doing the reenactment, or the training reenactment on the prone positional restraint, right? Several were 75% blocked. He said all his arteries. That other doctor said all his arteries. This is saying several were 75% blocked and one was 90% blocked. You only need one artery that's 90% blocked. And that was made worse by where the clogs occurred in terms of crimping the supply of blood to his heart. Nelson said blockages of 70% or more usually cause chest pain. He added, that degree of narrowing is sufficient to cause the death in and of itself. Davis said Floyd also had an enlarged heart, 48% bigger than it ought to be, likely from his high blood pressure and heart disease. Nelson said a heart that is enlarged like this is more likely to develop an abnormal heart rhythm. Drugs. The autopsy notes signs of fentanyl, methamphetamines, and THC, the ingredient that produces marijuana's high in Floyd's body. Coronavirus. The autopsy said Floyd tested positive for the new coronavirus, which was supposedly causing issues too, right? But, so even though this article and Dr. Pierre Kory's testimony is, per this article, is saying that, they don't have problems breathing. They don't complain of breathing. All these things say that the NIH, says that opioids, you have problems breathing. You have trouble breathing. And the most dangerous side effect of fentanyl can be that it causes you to stop breathing. American Lung Association, right? Opiates can suppress breathing and block air from entering your lungs, leading to hypoxia and suffocation. And asthma can exacerbate, having prior lung diseases, including asthma. And per his own lawyer, he had asthma. That his lawyer says is irrelevant. But anyways, I'm not trying to retry the case. I'm just trying to show you Dr. Pierre Kory's testimony. Okay. Also, up here, we had, I'm sorry. There it is. Okay, shortly after Floyd's death in 2020, Dr. Pierre Kory was to give expert medical testimony in the George Floyd civil case. Prior to the case, Dr. Kory had years' experience in the ICU and pulmonary wards of busy hospitals and describes himself as having taken care of many, many dozens of opioid overdoses in ICU. And just to expand on that a little bit, I got opioid overdoses tops list of leading causes of death in the U.S. Okay. This is an article. The odds of dying from an accidental opioid overdose in the United States are greater than those of dying in a car accident. According to findings from the National Safety Council, the lifetime odds of overdose are 1 in 96 compared to 1 in 103 for vehicle death. A 2018 report from the U.S. Center for Disease Control and Prevention, the CDC, supports this finding, identifying unintentional injury as the leading cause of death in the U.S. In 2016, unintentional injury claimed the lives of 61,000 people aged 1 to 44, according to the report. Motor vehicle accidents and unintentional poisonings. Wait a minute. Yeah. Motor vehicle accidents and unintentional poisonings, which include drug overdoses, are the primary cause. The CDC recently reported that life expectancy in the U.S. declined from 2016 to 2017 due to an uptick in drug overdoses and suicides. So just the uptick in drug overdoses and suicides was enough to have the CDC report that life expectancy in the U.S. had declined. And that was an article from CNN in 2019. Nevertheless, Dr. Kory, along with other medical freedom players, has outright denied the opioid crisis as a factor in the death count of COVID, including its COVID countermeasures whatsoever. Okay. I'm going to play the first 6 minutes of this
I've had
video.
these dental implants for 6 months
Sorry
now,
about
and here's the shape I was in before getting them. Permanent teeth
right?
in 24.
Sorry about the...
I'd like to tell you a story, son.
The president just posted on social media that he had spoken with Prime Minister Trudeau. He says he's not satisfied with what the Prime Minister has said.
Mark Kulak from Housatonic put this together, but I think it shows a couple things. I'm going to play the first 6 minutes of this for you.
When it comes to fentanyl, but less than 1%, as you know, less than 1% of the fentanyl seized last year was in the northern border. What else does Canada need to do?
Well, the president did just put out a statement on his call with the governor, Justin Trudeau, as he calls him, of Canada. And he said that he was not pleased, as you said. He said it's not good enough. He told Prime Minister Justin Trudeau that directly. The call ended in a somewhat friendly manner, as the president said, but he's not going to stop standing up for the American people. And to answer your question directly when it comes to fentanyl, for the last 4 years, unfortunately, our neighbors to the north and the south, Canada and Mexico respectively, have allowed America to be a dumping ground, not just for illegal aliens, but for illegal, poisonous, deadly fentanyl, which is now the #1 killer of young people in this country aged 18 to 34.
And Dr. Jessica Rose, you recently wrote a post about the deaths among millennials. What does the data show about that?
So yeah, there's this surge of deaths in millennials, which are 25 to 44-year-olds. These are young people. 84% surplus of deaths in the fall of 2021, which is completely unexplained. Nobody knows why. According to what I've found, it's not due to drug overdoses and suicides.
Illegal, poisonous, deadly fentanyl, which is now the #1 killer of young people in this country aged 18 to 34.
There's this surge of deaths in millennials, which are 25 to 44-year-olds. These are young people. 84% surplus of deaths in the fall of 2021, which is completely unexplained. Nobody knows why. According to what I've found, it's not due to drug overdoses and suicides.
Illegal, poisonous, deadly fentanyl, which is now the #1 killer of young people in this country aged 18 to 34.
There's this surge of deaths in millennials, which are 25 to 44-year-olds. These are young people. 84% surplus of deaths in the fall of 2021, which is completely unexplained. Nobody knows why. According to what I've found, it's not due to drug overdoses and suicides.
Illegal, poisonous, deadly fentanyl, which is now the #1 killer of young people in this country aged 18 to 34.
Mortality was 26% higher among insured 35 to 44-year-olds and 19% higher for 25 to 34-year-olds, continuing a death spike that peaked in the third quarter of 2021 at a staggering 101% and 79% above normal, respectively. Now, Bring in Dr. Pierre Kory. Why is this not a bigger story? Why isn't this not front page news? Why aren't public health officials also screaming and clamoring, trying to figure this out and help our own people?
Those are all very good questions. We're witnessing a humanitarian catastrophe unleashed by these vaccines. All that data that I put forth, it's even worse than that. When you look at the actuarial data, you see who died. It was literally the healthiest, most employed, most educated Americans dying at rates never seen outside of wartime. And you're only left with one question. Jimmy, do you know what happened in the American workplace in the third quarter of 2021? Was any new rules, regulations?
I think there were some vaccines that were mandated.
Oh, yeah, I remember that. Yeah, universities, schools, businesses, government, healthcare, and you see this outrageous spike in those actuarial tables.
So you're saying it's not because people are watching too much late night TV and snacking on crunchy food? Or
well, unless those were introduced into the American diet in the third quarter of 2021. Yeah. I mean, to me, it's all about temporal association. And I mean, obesity, even like, and I've heard people, I've heard like mass media journalists trying to come up with, alternative explanations, like the opioid epidemic. We unleashed fentanyl on the streets in 2021, right? It's been around for 10 years. We know the opiates are a big cause of deaths among young people, but these were not drug deaths. They were not COVID deaths. A lot of them were unexpected. We have data.
Illegal, poisonous, deadly fentanyl, which is now the #1 killer of young people in this country aged 18 to 34.
There's this surge of deaths in millennials, which are 25 to 44-year-olds. These are young people. 84% surplus of deaths in the fall of 2021, which is completely unexplained. Nobody knows why. According to what I've found, it's not due to drug overdoses and suicides.
You see this outrageous spike in those actuarial tables.
So you're saying it's not because people are watching too much late night TV and snacking on crunchy food?
Well, unless those were introduced into the American diet in the third quarter of 2021. Yeah. I mean, I've heard like mass media journalists trying to come up with, alternative explanations, like the opioid epidemic. We unleashed fentanyl on the streets in 2021, right? It's been around for 10 years. We know the opiates are a big cause of deaths among young people, but these were not drug deaths. They were not COVID deaths. A lot of them were unexpected. We have data.
You get the idea, right? Well, the whole thing with Dr. Kory denying, not only is he denying that, opioids had anything to do with George Floyd's death, he's denying that opioid deaths had anything to do with that. He's trying to blame it all on the vaccines. They don't have anything to do with COVID either, right? The opioid deaths don't have anything to do with COVID. Don't have anything to do with George Floyd, even though he was full of opioids, right? I don't know. But anyways, you can't say it isn't consistent. That is, his testimony there, or his denial of COVID, or his denial of opioids. Sorry. Oh, Pete. There you go, kid. All right. Trying to get P set up over there. But anyways, his denial of opioids being relevant to any of it is across the board, right? So, I'm sorry about this camera. It just keeps, the whole thing just keeps screwing up to me. I apologize. So we've got that done. As also noteworthy is Dr. Kory's assertion that the highest death rates during the COVID were literally oh, what do we got? What do we got? What do we got? Oh, thank you. Thank you. My better half. You come in here. Thank you, beautiful. She brought me. Cool, you ain't got nothing on me, man. I had my wife bring me a coffee, too. But anyways, thank you, beautiful. I wouldn't be able to do jack shit around here if it wasn't for my wife. Literally. But also noteworthy is Dr. Kory's assertion in that video clip that Mark put together that the highest death rates during the COVID were literally, his quote, literally the healthiest, the most employed, most educated Americans dying at the rates never seen outside wartime, despite the fact that one, per the AMH, Americans 65 or older made up 92% of all deaths from the virus. And two, per the NIH PubMed Central, I'll say that MIA article says, American Medical Association article, right? Yeah, it's just Americans 65 or older made up 92% of all deaths, yet Kory says literally the healthiest, most employed, most educated Americans dying at rates never seen before in wartime. Doesn't make sense. But also that 92% of all deaths that came from the virus over 65 would point to the fact that the boomer population pyramid was there too, because you got way more people over 65, way more people reaching life expectancy or close to life expectancy, right? So you're going to have more people dying. So that gets rolled into that too. And two, per the NIH PubMed Central, this article right here, compared to younger adults aged 18 to 64, older adults were more likely to report serious adverse events, deaths, permanent disability, and hospitalization from the vaccines. So everything Kory just said in there. Everything medical freedom doctor, Pierre Kory. Literally the healthiest, most employed, most educated Americans are dying at rates never seen outside wartime, but according to the American Medical Association, and I did a whole video on the population, the baby boomer population versus deaths and the sepsis connection to that, right? And the baby boomer population pyramid. All of that points to the fact that, literally the healthiest, most employed, most educated Americans are dying at rates never seen outside wartime. Whether it's COVID, which 65 or older accounted for 92% of all deaths, or the vaccines, which according to PubMed, compared to younger adults between 18 and 64, older adults were more likely to report serious adverse events, death, permanent disability, and hospitalizations. Dr. Pierre Kory has been known since 2020 when he's pushing the narrative on the mask, pushing the narratives on asymptomatic spread. How is he not pushing the narrative here? I don't know. It is what it is, right? I just wanted to point that out. Just wanted to point out those couple discrepancies. Medical freedom doctor, Dr. Pierre Kory. Sorry, close your eyes. Sorry, I'm going back down through here. Okay. Now, I got another article here that I want to read to you to kind of bring into focus what I'm getting at as far as what I'm getting at as far as the bigger picture that Dr. Pierre Kory is actually pushing here with his testimony to counter the first medical examiner's expert testimony. to go over that. It's good coffee stuff. Thank you. Addressing systemic racism in the U.S. and the mass incarceration in the mass incarceration of people of color. Now, this whole mass incarceration narrative is a narrative that comes straight out of revolutionary communist anarchist doctrine. It was born there. Okay, disparate impact, it was born there. Okay, and I just wanted to, I mean, it's become mainstream politics today, but basically what it is an exemplary of is that how mainstream radical, revolutionary, communist, and anarchist doctrine has actually become in contemporary politics. But let's read this article from this guy. He wrote this in 2020, which is right about the same time, June 2020, right about the same time that he's doing this testimony with George Floyd, right about that, Kory's doing all this stuff. But anyways, the brutal killing of George Floyd and Breonna Taylor, okay, which is Breonna Taylor, which is another person, by police has catalyzed a groundswell of action against racism and police brutality across the country. Remember, Pierre, Kory, in that article, it was determined that the death of George Floyd was by police brutality, right? We stand in solidarity and believe it is our duty to demand the work for systemic change to end racial injustices and inequality. And it's not just the officers. It's not just the officers that are that where the justice is here. It's the in particular officers or the Minneapolis Police Department or of law enforcement. They want systemic change to end racial injustices and inequality. Systemic change. That means that we have it isn't racism. Racism is just a product of the real problem, which is systemic white supremacy, whiteness of America, systemic racism. Just being an American or being white in America makes you racist because the whole American system was designed by white people for white people. The whiteness and white supremacy, the inherent whiteness and inherent white supremacy of America, as founded, as is evidenced by the 3/5 clause. That's the accusatory. And I've also done a series of Defense in America videos where I go over all that. You know what I mean? I don't see anybody out there doing anything in defense of America or presenting the accusatories against America for what they are. They're accusatories from the perspective of the collectivist revolution against our republic. That's what they are. They're not objective. But this is what I'm showing you. They're calling for systemic change to end racial injustices and inequalities. Can't have equity where there's inequalities, right? We must root out the deep unconscious racial bias and white supremacy. See, I'm making this shit up. Racial bias and white supremacy that permeates our culture and end police violence and all abuses of police power. To this end, we support anti-racist policy reform at the state and federal level. Yeah, to this end, we must support anti-racist policy reform. Okay, now I've got a couple dots up here. The brutal killing of George Floyd. Okay, I've got meanwhile, centralized progressive fact-checking has been policing public communications to maintain the centralized critical race theory-based narrative control. So I wanted to show you this. Remember during COVID when you were looking for trying to find any type of objective science to try and dispel bullshit science, but you wound up finding everything is just bullshit science anyway, so all we were left with in reality was bullshit science to try and prove or show other bullshit science right or wrong. I don't know. It's frustrating. But this article here, fact check. It's a fact check by Reuters, right? No evidence drug overdose was main cause of death for George Floyd, because somebody had posted somewhere that he had died from drug overdose, as was consistent with other evaluations, professional evaluations in the case, right? But I just wanted to show you that it was fact checked. So the fact that George Floyd may not have died from police brutality is fact checked. Yeah, so it says social media users are reviving a claim that George Floyd, a 46-year-old black man killed in 2020, actually died due to drug overdose. Other people had shared and said that George Floyd died of fentanyl overdose and that Derek Chauvin should be freed. And they were fact-checking that. Yeah. Medical examiners ruled the death of a homicide because law enforcement officers compressed Floyd against the road in a way that starved his body of oxygen, known as asphyxia, leading to the arrest. There is no evidence to suggest he would have died that night, except for the interactions with law enforcement. So it was fact-checked. I'm just saying. Remember when they were doing that for COVID narrative? Remember doing that for everything? This whole critical theory, critical race theory is just another narrative that is being fact-checked by the same public-private partnerships and centralized, trusted news networks. Just pointing it out. To this end, we must support... Sorry about that. I don't know what the hell's happening there. We must support anti-racist police reform at the state and federal levels. I want to point out, remember that per the same critical Marxist collectivism, how to be an anti-racist is to be an anti-capitalist. And that's right in here. I've read this before stuff, but right in here in this book. You want to be an anti-racist? All you got to be is an anti-capitalist. Be an anti-capitalist and you're an anti-racist, because capitalism is racist. It's inherently exploitative. Again, a narrative straight out of radical communist and anarchist doctrine. And even some nationalist doctrines. Though systemic racism permeates many of our institutions, it is most entrenched in our criminal justice system, including how the war on drugs, Trump doesn't disagree with that. Trump didn't disagree with that when they came up with their first step, criminal justice reform, where we had revolutionary communist Van Jones working with him on how to, come up with, rectifying racial injustices and disparate impact, right? Yeah. And it's most entrenched in our criminal justice system, including in how the war on drugs is waged inside communities of color. The war on drugs. Okay? Yeah, it's coming into play here too. Now you have progressive policies that go back to the progressive era. The war on poverty, the war on crime, the war on drugs. All part of the same progressivism that came out of the progressive era through different presidents, right? Just as the Jim Crow era of legal segregation replaces the institution of slavery, Jim Crow legislation was progressive era legislation. But they don't tell you that. They'll tell you that it's America's founding principles, that it's the inherent racism of America is founded in our Constitution and our Republic. They don't tell you that it comes from the racial segregation and Jim Crow that they're calling out is actually a product of their own progressivism, the same progressivism that they're championing. They don't tell you that. They don't tell you that. Yeah, just as Jim Crow era legal segregation replaces the institution of slavery as the main form of institutional racial control in the U.S. from the Civil War through the 60s, so has the mass incarceration of black and brown people via the war on drugs and otherwise. This is what I'm getting at here. Replaced Jim Crow. It has via the war on drugs and otherwise replaced Jim Crow. It's the new Jim Crow. The prison industrial complex is the new Jim Crow, where America's white laws and whiteness and white supremacy and its white laws with its attack dogs, the cops and the military enforcing that white law, right? The white supremacy of white law that's segregating black and brown people or are unwanted, the oppressed. It's segregating the oppressed away from the white oppressor because we just don't want them around. So the whole society is set up just to put black and brown people and minorities and people we don't want around us in prisons. That's what they're saying. It's straight out of anarchist doctrine, straight out of revolutionary anarchist and communist doctrine. Michelle Alexander's book, The New Jim Crow, Mass Incarceration in the Age of Colorblindness. That's the other thing. To be colorblind is to be racist now. You can't judge a man by his character, not the color of his skin. You have to recognize the color of his skin, period. Otherwise, you're racist. Michelle Alexander's book, New Jim Crow, Mass Incarceration in the Age of Colorblindness, lays bare how systemic racial control operates institutionally via the criminal justice system in our society today. Quote, in the era of colorblindness, it is no longer socially permissible to use race explicitly as a justification for discrimination, exclusion, and social contempt, so we don't. Rather than rely on race, we use our criminal justice system to label people of color criminals. So what our white law does is it just criminalizes people of color that we don't want around. That's the accusatory. It's the standard critical race theory accusatory. And then engage in all practices we supposedly left behind. Engage in all the practices we supposedly left behind, which would be like what? The KKK and lynchings? Today, slavery. Today, it is perfectly legal to discriminate against criminals in nearly all ways that it was once legal to discriminate against African Americans. Once you're labeled a felon, the old forms of discrimination, employment discrimination, housing discrimination, denial of the right to vote, denial of the education opportunity. You have a right to education in prison. Denial of food stamps and other public benefits and exclusion from jury service are suddenly legal. As a criminal, you have scarcely more rights and arguably less respect than a black man living in Alabama at the height of Jim Crow. We have not ended racial caste in America. We have merely redesigned it. The United States has 4% of the world's population. This is a standard tactic, too, in collectivist doctrine, socialist, communist, anarchist, humanist. It doesn't matter. The United States has 4% of the world's population, but 22% of the world's prison population. In significant part because of the brutal war on drugs. Again, the war on drugs comes up. Again, a progressive policy from a progressive era presidents. Despite using drugs at the same rates as whites, blacks and brown people are much more likely to be targeted by police, arrested, and incarcerated. Yes, because I don't know where they get that stat that white people use drugs as much as black people, but I don't know. I don't know. It's just it kind of struck me as curious. anyways, it doesn't really matter for what I'm trying to point out here. As Cassandra Frederick, incoming executive director of the Drug Policy Alliance, relayed in an email, time and time again, drugs are used as a justification to target, harass, assault, arrest, incarcerate, and kill black people by law enforcement. Now, we've got a huge denial across the board of opioid deaths and drug overdoses having anything, even though it's been recognized that drug overdose deaths in and of themselves have reduced our life expectancy in this country across the board, right? There's also simultaneously, for some reason, across the board denial, Dr. Pierre, Kory included, of opioid deaths having anything to do with the numbers in anything significant, including COVID or the vaccine death count. They don't want interfering with that. And this critical theory progressivism doesn't really want to push it forward because of what they just said here. Despite using drugs at the same rates as whites, blacks and brown people are much more likely to be targeted by police, arrested, and incarcerated. Yeah. Time and time again, drugs are used as a justification to target, harass, assault, incarcerate, and kill black people by law enforcement. So you start talking about the opioid deaths and the drug deaths in this country being high and raising and getting higher and higher and higher, and being as the number one cause of death, even as that one video from the Trump administration was saying, right? And a certain age group or whatever, or just number one cause of death, I don't know. But it's up there, right? You start bringing that shit up again, and they're going to say, well, they're going to have a war on drugs again. We can't have that because of the critical race theory accusatory against America of mass incarceration and the new Jim Crow of the prison industrial complex. I'm just putting it out there for your consideration. It's all there. It may or may not be relevant, but it's all there. All right. George Floyd drew his last breath after one police officer knelt on his neck for nearly 9 minutes and another taunted, "Don't do drugs, kids," to the gathered crowd. Did that really happen? But you can see how this article is being put forth by a person perpetuating a certain narrative, right? The narrative of the oppressed versus oppressed context of the Communist Manifesto, and the critical theory and critical race theory of the revolutionary Marxism that has targeted our republic for destruction. George Floyd drew his last breath after one police officer knelt on his neck for nearly 9 minutes and another taunted, "Do not do drugs, kids," to a gathered crowd. Breonna Taylor was shot to death in her own bed by Louisville police in what was a baseless warrant on a drug investigation. We must fight to remove drug involvement as a cover for disregarding the dignity and sanctity of human life. Reforming the racist war on drugs is a critical piece of fighting against systemic racism, and that is why we focus energy and resources as a company to support legislation that treats addiction compassionately, not criminally. People who are addicted to drugs should receive the help and treatment that they need in a way that doesn't further destroy their and their families' lives. Yeah. Since 2001, Portugal has showed the way, implementing expanding treatment programs in place of jailing low-level drug offenders and addicts, while continuing to criminalize trafficking and drug distribution of drugs. Down here says, let's work together to reform systemic racism however it manifests institutionally in our society. Whether in police practices or government policies, together we are all one or none, all one. Black Lives Matter. Black Lives Matter. You know, a powerful slogan put together by people that have, pushed that narrative that are known Marxists, self-proclaimed Marxists, right? This isn't to argue one way or the other in regards to the continued criminalization of drugs or not, but to point out that the alleged racial disparities allegedly resulting from the actually progressive racist war on drugs, with its allegedly inherently racist criminalization of drugs, is being utilized by the collectivist revolution against our republic via the critical doctrine, critical theory, and critical race theory is just part of critical theory. The critical doctrine as a recruiting tool to gain more and more populist support among the oppressed or marginalized, as per the Communist Manifesto, as per the oppressed versus oppressor context of the Communist Manifesto, in favor of the collectivism at large, be it anarchist, communist, humanist, technocratic, or nationalist, targeting not just law enforcement and structure of our legal system, but the whole of America as founded, our individual rights, liberty, and constitutional republic for destruction. Yes. Might the bipartisan critical theory or critical race theory led populist progressivism of the anti-war on drugs narrative have anything to do with the broad denial, at least till recently, of the ongoing opioid crisis, as I was saying? Just putting it out there. I mean, it's been tough to get nobody in the medical freedom movement at all wants to talk about the drug and the opioid crisis and the deaths involved with that. Nobody wants to talk about it. Pierre, Kory, Jessica Rose, other individuals have outright denied it has anything to do with anything. Now, they're all progressives. They're all leftist progressives. The supposedly right-wing MAGA Maha is all loaded by a bunch of freaking progressives, leftist progressives. Now, in their innate progressivism, as they go right progressive, their innate collectivism, their innate leftist collectivism, do they still harbor that critical theory, critical race theory foundation to their way of thinking and the way they see things and the way they hear things that they all obtained in that collectivist eye through which to see things, the collectivist ear through which to hear all things, and the collectivist mindset through which to understand everything that's happening around them when they go through the dip of academia and upper academia? They're still stuck to this narrative. Well, the war on drugs is racist and all this other shit's racist, right? So, I don't know. Makes sense to me, kind of put two and two together. You have to kind of connect some dots there, but it's consistent. It's throwing it out there for your consideration. Or how those lost to the opioid crisis have been used along with the boomer population pyramid, the bullshit PCR tests, centralized zero or extremely limited centralized treatment protocols, and prolific use of pressurized oxygen or high-flow oxygen to bolster the mythology of a pathogenic or even asymptomatic spread of a novel zootonic jump and or gain-of-function RNA virus from a bat cave mud puddle, and therefore the need for a mass compliance to centralized countermeasures like N95 masks per medical freedom doctor Pierre Kory, including social distancing, which Dr. Pierre Kory mentioned as well, mask lockdowns, not to mention the centralized collectivist restructuring of not just America, but the whole of the Western free world. And that's what they did in the lockdowns. And they used all that shit to justify it. 50 years ago, President Nixon declared the war on drugs. I just kind of want to go over some of how the progressivism of this war on drugs. 50 years after the President Richard Nixon declared a war on drugs, the United States is still mired in the implications of this wrong-headed, racist policy decision. Yeah, Nixon's war on drugs. He was a progressive, undeniably a progressive. Republican or Democrat, doesn't matter. He was a freaking full-blown progressive. And the other thing is that war on drugs, he didn't come with that. It didn't come out of nowhere. Came out of the war on poverty and the war on crime and the war on everything else as the progressives were doing. The role of policy in the media and Reagan's war on drugs. Now, of course, Reagan was doing that. Remember Mrs. Reagan just saying no? 50 years into the war on drugs, cocaine had taken a prominent victim. You know, a basketball guy, famous basketball player. The war on drugs have made media and culture a battleground, but the United States government waged it. In the 1960s were undoubtedly difficult for Americans and their nation. A war raged overseas and wide-scale civil unrest erupted over continued racial disparities again, right? In order to combat these issues, President Lyndon B. Johnson started the war on crime and the war on poverty, part of his Great Society. Right? The war on crime expanded surveillance, patrol, and detention. The war on poverty created the more opportunities for economically disadvantaged people through financial assistance and training opportunities. Now, all of this, the whole of it is progressive. But what they're going to do is they're going to give you a limited spectrum of debate. Here, these programs referred to as Great Society policies set a precedent for social programs to be active participants in law enforcement. For example, Great Society policies indicate that punitive measures to prevent crime must be implemented to support lower-income families, who were more likely to be people of color. Yeah. So if you enforce, people of color were more likely to be victims of crime. So if you enforce the crime, you're helping the people that are most likely going to be victims of crime, which are colored people of color. Law enforcement became essential to furthering any social programs. Law enforcement became essential to furthering any social programs or societal goal. However, while President Johnson, the Democrat, right, attempted to fix many of the root causes of many issues in America, like poverty, unemployment, and housing, President Richard Nixon and Ronald Reagan, Republicans. Well, Reagan was a Democrat first, like Trump, wasn't he? I don't know. Nixon and Ronald Reagan decided to focus on drugs, so to give you that limited spectrum of debate. Meanwhile, the whole of it, all of them were progressive. Even Reagan, to some degree, was progressive. That's why we have, the immunity from liability on the pharmaceuticals, on the vaccines, right? As discussed in Michelle Alexander's New Jim Crow, the war on drugs was a significant cause of the mass incarceration of people of color. Again, Michelle Alexander's New Jim Crow is rolled into it, right? All under the war on drugs. It all comes under the same thing. All comes under the, again, in the strands of the collectivist web come back around and around and around. Ending the war on drugs and preventable overdose crisis. Core message: no matter how much money is put in our pockets or what we look like, no one should have to struggle alone or live in pain. But for decades, Big Pharma has profited off opioids. Yeah. While demonizing the people who became addicted to the drugs they marketed. At the same time, some politicians have weaponized fear to push a deadly drug war. The failed drug war targeted millions of poor, black, brown, and indigenous people, tore apart families, locked people up for decades for minor crimes, and failed to save the lives of those killed by preventable drug overdoses. So it's the It's the racism. The racist, the failed drug war, the racist drug war that has failed to save the lives of those killed by preventable drug overdoses. It doesn't have to be this way. We can come together across gender and creed, united in our commitment to building strong and healthy communities, to put care over criminalization and demand an end to the drug war. Drug war targets black communities. Okay, I just kind of wanted to show you this here too a little bit. Arizona, Montana, New Jersey, South Dakota legalized marijuana. 1 in 3 Americans now live in states with legal access for adult use. Kind of going into this here. In 2017, 27% of the people arrested for drug violations were black, although black people make up only 13% of U.S. population. That's the tactic straight out of revolutionary collectivist doctrine too, and use drugs at roughly the same rates as other racial groups. Okay. Sources cited. I wanted to go into the sources cited where they got all this stuff, okay? The Hamilton Project and the Brookings Institute. Rates of drugs used and sale by race. Rates of drug-related criminal justice measures by race. This came out in 2016, okay? But this is the source that they cited for this. I'm just saying, there's no justification for these numbers really outside collectivist doctrine, revolutionary collectivist doctrine, or Marxist academia. I mean, try to find it. Try to find it somewhere where it isn't Marxists citing other Marxists, citing other Marxists, that all this is true. You know what I mean? On Influence Watch, I went to the Brookings Institute. Okay, funding from the Brookings Institute, sorry. In 2019, the Brookings Institute received over $102 million in revenue. Over $78 million of it came from donations from a wide array of organizations. Among the institution's largest donors were the Hewlett Foundation, Arnold Ventures, and Hutchings Family Foundation. 3 left-of-center granting foundations, which each donated $2 million in 2019 alone. Left-of-center, which means leftist, collectivist, progressive. Communists, but anarchists like to say they're left of communism. The Bill and Melinda Gates Foundation, Ford Foundation, and the Kresge Foundation, 3 of the largest private foundations in the United States and major supporter of left-wing causes, all gave between $1 and $2 million. The left of center, Carnegie Corporation of New York, Alfred B. Sloan Foundation, the Annie E. Casey Foundation gave between $500,000 and $1 million, as did the Libertarian Charles G. Koch Foundation, right? Left of center donors in the $250,000 to $500,000 range include John D. and Catherine MacArthur Foundation, McKnight Foundation, which got a lot to do with the fact-checking shit, Omidar Network Fund, Tides Center, and Walton Family Foundation, as well as a former Federal Reserve Chairman Ben Bernanke, who is also a distinguished fellow at the Institute. Left of center donors in $100,000 to $250,000 range include the Democracy Fund, Joyce Foundation, New Venture Fund, Rockefeller Brothers Fund, Rockefeller Foundation, and the Andrew H. and Anna R. Tisch Foundation. Just to show you who is funding the source that they use to come up with all that, right? Foreign government funding. The institution receives considerable funding from foreign governments, with 8 government donors giving at least $100,000 in 2019. Just showing you. There's a lot of international influence. And I kind of want to get to a little bit of the foundation behind this mass incarceration. Behind the whole mass incarceration, accusatory, disparate impacts, accusatory, and George Jackson. There's an article here, Why George Jackson Matters Through the Lens of Blood in My Eye. Blood in My Eye was a book that George Jackson wrote. George Jackson was a guy that was put in jail. He was a cop killer, but he was put in jail, put in prison And just, while he was in prison, his lawyer or somebody brought him in a gun, and he snuck it in his hair up to the box where he was. And when he got back up to his housing unit, he wound up shooting, I don't know, at least one officer, 2 or 3 officers, and I think they murdered at least 2 or 3 officers, if not more. Slit their throats. Yeah. He was also one of the Soledad brothers, and his brother, while the Soledad brothers were in court, his brother got some guns from Angela Davis, another revolutionary communist affiliated with the, well, not really the Weather Underground, but the other Weather Underground supported these guys, but it was the Black Panthers. But they, George Jackson's brother wound up getting some guns from Angela Davis, brought it in. They took the judge hostage. Taped a double-barrel shotgun underneath the judge's head, which wound up going off and blowing his head off, basically. But these guys all got in a shootout with the bailiffs and the corrections officers that were in the court. It was a freaking mess. George Jackson was involved with the Soledad brothers. I don't know if he was actually there that day or not. I can't remember. I did a big write-up on it, and it's been years since I've looked at it, but why George Jackson matters is important to this story, because this is the part of the narrative that that medical freedom doctor Pierre Kory is pushing. A little bit more on the base of what he's actually pushing when he's pushing the critical theory narrative, when he counters the findings of the original examination, right? On behalf of the George Floyd family, you know what I mean? To show that George Floyd was murdered by police brutality. End of story, This is just a little bit more into that, just so that you have an idea. Just so you have an idea what he's actually pushing when he testified. And you see that other people are bringing it up, that Dr. Pierre Kory testified. It's not just his testimony. It's the spin-off support that the whole revolutionary movement gets from his testimony. It has repercussions, like the butterfly effect, like a Mothra effect. The same U.S. imperialists. See, this is written by a communist organization, the Black Agenda Report. They're a communist organization, a revolutionary communist organization. Okay, they write that this is back in 2015 that they wrote this. The same U.S. imperialist system George Jackson broke down in Blood in My Eye remains dominant throughout the world, but there riper conditions to spread its misery. Black America is in a worse economic state than it was during Jackson's period, and so too is the state of the entire working class. Of course, the entire working class. The mass black incarceration state has since been erected to block poor black Americans away from capitalist economy that no longer needs their labor, and at the same time repress the potential development of black revolutionary activity against the state. It was George Jackson who developed a foundational theory of prison state in relation to the design of the imperialist system. They credit George Jackson, the Mao communist cop killer inmate, okay? This is who they champion. Okay? He succinctly summarized the purpose of the mass black incarceration state in Blood in My Eye. As such, the ultimate expression of law is not order, it's prison. The law and everything that interlocks with it was constructed for poor, disparate people like me. George Jackson traced the development of mass black incarceration state to the U.S. government war on Black Panther Party, which Jackson joined while in prison, he also started a gang called the Black Guerrilla Family. Jackson's analysis was informed by a brutal repression he and the Panthers faced at the high tide of the Black Liberation Movement. It was also solidified by what he saw from directly behind the walls as the changing character of U.S. prisons into an institution specifically made for black people. The struggle against police brutality and the prison state today has much to learn from George Jackson's analysis. This is what I'm getting at. There isn't much difference in this communist literature, revolutionary communist literature, celebrating the revolutionary communist foundings of the foundational theory of the prison state in relation to the design of the imperialist system and the black mass incarceration, right? The critical resistance, the Angela Davis that I was telling you about, well, all these people like Weather Underground, Bill Ayers, Bernadine Dorn, and including George Jackson. The officers at the facility, one of the tower officers, wound up shooting him after he went running through the prison yard after he just killed those officers, and they shot him. But Angela Davis went on to be a celebrated hero. They took her to, they wound up going to court about the guns that they took for that. They were trying to bust that guy out of the court. They're the Saladet brothers, with George Jackson's brother, got the guns from Angela Davis. They took Angela Davis to court. She was found innocent, and she's still and wound up becoming college professor. Highly respected college professors in leftist progressive academia. And of course, Critical Resistance is Angela Davis is one of the co-founders of this group, Critical Resistance. And in there, where they say abolition isn't just about getting, they call themselves prison abolitionists. Or for abolition comes from the word abolish all prisons. There is an anarchist, a woman by the name of Emma Goldman in the turn of the century, early 1900s. She wrote, anarchist essay, in her anarchist essays. One of her things that she writes, which is very consistent with like Bakunin and Prodhan and other, Kropkin is another big anarchist, doctrine originator, OG anarchist, But Emma Goldman, she had this thing called abolish all prisons, And that's where this abolition comes from, is Emma Goldman's basically abolish all prisons kind of thing. And that's what they say. It's not just about getting rid of buildings full of cages. Prison abolition is not just about getting rid of buildings full of cages. It's also about undoing the society we live in, and this is the point that I'm trying to get across. There's no fix to structural racism. There's no fix to structural white supremacy. If it's structural, it can't be fixed. It's got to come down. Right? There is no fix. You buy a house that's got structural problems, you're done. You got to take it down. What is the Black National Anthem, and why is it sung before the Super Bowl? This is the other thing, when Kyle Kaepernick or whatever his name was there, they're doing in the kneeling down stuff and at the football games, and they started singing this, what they called the Black National Anthem. And it has a history, it has a history that people are wholly unaware of. But it can get rolled in here a little bit of background on this narrative that's being pushed forward through mainstream sporting events like NFL, right? Why is the Black National Anthem sung before the Super Bowl, right? The NFL began having a singer perform Lift Every Voice and Sing before the Super Bowl in 2020, all around the same time, okay? In the wake of racial and social justice protests in the United States, right, following the death of George Floyd, okay, at the time the NFL committed to singing the Black National Anthem before the Star Spangled Banner ahead of every NFL game during week 1 of the season. So now we've got a Black National Anthem and the American National Anthem. So America has now we have 2 national anthems now, one specifically for black people. How do you think the revolution against America as a unified country and republic is going to see that, right? What is the Black National Anthem and why is it important? This has come from this article right here. I'm reading out of this article right here. NBC. And it was written in February of 2024. So it was written about a year ago. You know, it's not that. It was written about a year ago. Right? Why is the Black National Anthem sung before Super Bowl? Why is the Black National Anthem and why is it important? Okay, Lift Every Voice and Sing was originally written as a poem by James Weldon Johnson. But his brother, Jay Rosman, turned it into music. The song was performed for the first time in 1900, not long after it was written. The NAACP dubbed Lift Every Voice and Sing as the Black National Anthem in 1919, more than a decade before the Star Spangled Banner was named the national anthem. Okay. Now, a little history on this James Weldon Johnson and his brother. Okay. W.E.B. Du Bois, okay, was the first African American. This is from the Communist. This is from the Communist Party USA. This is from the Communist Party USA. Talking about okay. W.E.B. Du Bois was the first African American to receive a PhD from Harvard University. He encountered socialist ideas while he was studying in Germany, where he occasionally attended rallies in Germany's Social Democratic Party. A pioneer of the U.S. sociology and prolific author, Du Bois was one of the founders of the National Association for Advancement of Colored People, or the NAACP, and was the first editor of the journal Crisis. Okay. In 1961, after a lifetime scholarship and activism, he joined the Communist Party USA, saying capitalism cannot reform itself. I think Shannon Joy would probably agree with that now, right? Communism is the effort to give all what they need. Communism is the effort to give all what they need and to ask of each the best they can contribute. This is the only way of human life. That's W.E.B. Du Bois, right? There was a movement at the turn of the century. There was referred to as the New Negro Movement that was affiliated with the Communist Revolution, the Bolshevist Revolution in Russia, and they were even recruited by the Communist International, affectionately referred to as the Comintern. There was like 3 or 4 of them, but in order to spread communism, to spread on behalf of the Communist Party worldwide as a global philosophy. Sorry. And they wanted to, and these people that were involved in this, including James Weldon Johnson, were trying to bring the Russian Revolution home to the United States. Yeah. Okay. From an email that I sent out in 2023, I sent this out. Black National Anthem, James Weldon Johnson, and the Comintern. With all the brouhaha about the Black National Anthem, I have heard nothing about the author James Weldon Johnson working in conjunction with and in support of agents of the Comintern, Communist International. who together worked to, quote, bring the Russian Revolution home to America. In other words, Johnson had deliberately cultivated the trope of black identification with the Russian Revolution, and that's a quote. Okay. There's not a lot out there about this guy being a communist revolutionary because he was very careful about it. More behind the scenes. But I came across this article a couple of years back when they first played the Black National Anthem at an NFL game. I thought I'd dig it back out and send it to you. And I thought it was a good time to kind of, haven't really put this out to a lot of people. I've been sitting on this information for a while, except for an email tour I sent out, but it fits perfectly into here what's happening. It fits perfectly into the narrative, and we can see what's actually happening on the surface and how what's happening on the surface is being affected by, currents far below the surface and the waves on the surface, revolutionary currents far below the waves on the surface. He wrote the poem that became the Black National Anthem in 1900, a few years prior to, but was working in support of the Bolshevist Revolution before they won. A big thing is the boost the modern Black Lives Matter communist, anarchist, woke revolutionaries are getting from it. That's the thing. The same with Dr. Pierre Kory. They're getting a boost from that testimony and even the way he words his testimony. And the NFL continues its support of postmodern, anti-American collectivism that in the end intends on destroying it as well. Really. I mean, you can watch some of these videos on some of these places. They want to end the NFL because they're putting black people up there for buying and trading black people, right? I mean, that's the accusatory. Don't take my word for it. Check it out. Anyways, I got this article here, and this is it. Nope, that ain't it either. Nope, sorry. We'll just go there. We'll just go here. So this is the article. Okay. It was written in 2014, so it was before all this stuff was going on with the NFL and everything. And this is a academic paper out of Rutgers. This, impartial fulfillment for requirements of the degree in Doctor of Philosophy. Okay. It was on the internet. And I just got a couple, it's a pretty lengthy thing here, but I got a couple quotes out of here I want you to show you. To demonstrate the importance of the new Negro engagement with Russia. Okay, this is a Doctor of Philosophy or a potential Doctor of Philosophy writing this to try and become a Doctor of Philosophy. This study examines 3 primary spaces in which the engagement occurred, all of them different venues in the new Negro print culture. James Weldon Johnson's writings in the New York Age, which was a paper they put out. The Messenger, which is another paper, as edited by A. Philip Randolph and Chandler Owen, and The Crusader, edited by Cyril Briggs. Together they span a wide breadth of new Negro intellectual life. James Weldon Johnson, ever mercurial, had attained fame as an author, diplomat, and NAACP organizer, and was not widely known as a radical. Right. Randolph and Owen, on the other hand, made sure everyone listening knew of their radicalism. Additionally, they belonged to Socialist Party and retained the affiliation even after most Socialist Party members, inspired by the Bolsheviks, had left to form the Communist Party. Little history there. And who this guy was working with, okay? And who Weldon Johnson was affiliated with. Eventually, the Messenger... Okay, eventually, the Messenger would become a site for vicious anti-communism. Briggs, Crusader, espoused a black nationalism absent from either the Age or the Messenger. So anti-communism, you can be a national socialist and be anti-communist. You don't have to be like a pro-American to be anti-communist. Additionally, Briggs and his co-thinkers would, alone among new Negro enthusing over Russia, join the Communist Party. The ideological diversity of these venues highlights Russia's presence in a number of corners of New Negro thought. This is what I'm trying to get across. The New Negro movement and the Bolshevist Revolution, the Comintern, and the agenda of the Communist Party are each chapter considers one publication, and each publication illustrates illustrates different aspects of the intellectual density alluded to above. Chapter 1 considers James Weldon Johnson's engagement with the revolution. Okay. Though his political origins in Booker T. Washington circles would not have suggested it, Johnson was transformed by his reading of the revolution more than any other figures considered in this study. Transformed more than any other figures considered in this study, as he became a partisan of Bolsheviks. Johnson shed a number of his earlier commitments and embraced what he saw as a rising revolutionary wave that would carry black Americans with it as it swept oppression from the globe. Of course, you got the Communist Manifesto, oppressor versus oppressed context, right? So it all kind of comes together here. However, Johnson also hid aspects of his enthusiasm for the revolution, only publishing those aspects of his thoughts that would not jeopardize his work with the NAACP, a practice I call, quote, doubly conscious rhetoric. He didn't talk about it because he wasn't a partisan Bolshevik. He hid it purposefully for political reasons. This did not jeopardize his work with the NAACP, which was, again, founded by communist W.E.B. Du Bois, right? Johnson's career thus demonstrates both the potency of the revolution had in shaping the contours of New Negro thought, as well as scholarly productivity of reconstructing his career from the vantage point of his explicit political commitments. Also of note, unlike the writers of the Crusader and Messenger, Johnson never explicitly called for an American Bolshevism. At the same time that he was looking to Russia, Johnson was the NAACP's main organizer. As such, his writings from this period are best read as an exercise in doubly conscious rhetoric, written to communicate his enthusiasm for what the revolution represented while avoiding expressions of radicalism that would place Johnson and the NAACP beyond the pale of American politics. It would just be too much. It would be beyond the Overton window at the time. Right. Other works showing socialist, communist influences the turn of the century New Negro movement. I just wanted to bring this out there because it's not just this one guy or just this one writer that was doing this, you know. You got this article, a book that just came out, review of a book that just came out in 2022, The Making of a Black Bolshevik, a review of Winston James's new biography of Claude McKay. I just want to point this out, too. The revolutionary Jamaican poet Claude McKay deserves a good Marxist biography and has found one. Winston James's new book on McKay illustrates the mind and art of one of the most important writers of the early 20th century, as it responds to the seismic contest between capitalism, colonialism, and socialism in the age of the Russian Revolution. It was a thing. It was a thing. James Weldon Johnson and the Black National Anthem came out of that thing, without a doubt. James' analysis of McKay, socialism, of McKay's 1921, Socialism and the Negro, argues that McKay's support for both the Garvey movements and international socialism was a possible nod to Leon Trotsky. Guys, Garvey was more of a black nationalist, right? But McKay, robust support for black liberation, including the Garvey movement and the colonial struggle, suggests that his analysis was likely influenced by at least equally by the Bolsheviks' prioritizing of colonial liberation after the 1917 revolution. Indeed, when he arrived in Russia in 1923, McKay was commissioned by the Comintern to write a pamphlet published as The Negroes in America, which likely influenced the Comintern's Black Belt thesis, that blacks were intentionally colonialized subjects. The Weather Underground in the 1960s wrote of America's quote-unquote internal colonies, the black nation, the red nation, the yellow nation, the gay nation, that kind of shit. Yeah, they weren't too much talking about the gay nation back in the 60s, but it's the same idea. Yeah, the blacks were intentionally colonized subjects. McKay's Comintern speeches also intended to emphasize self-determination movements in the colonies in the United States. The most troubling political weakness of the book, however, is James's refusal to engage with and take seriously the well-established evidence that McKay was bisexual. The most troubling political weakness of the book, however, is James' refusal to engage with and take seriously well-established evidence that McKay was bisexual. James's omission are more than a missed opportunity. McKay was part of the vibrant Harlem resistance and new Negro movements in which queer black sexuality flourished. State surveillance, social repression, and forced exile of gays and lesbians has become an important part of our understanding of why writers like James Baldwin ended up in Paris. Aaron Lechliter's 2021 book, Love's Next Meeting, The Forgotten History of Homosexuality and the Left in American Culture, also helps to fill in the records of queers and the left. I hope that James's second volume will look Claude McKay and his wider history more squarely in the face. Part of the challenge for Marxists seeking to recover and rebuild the struggle for socialism is in illuminating and celebrating all the shades of red in its spectrum. Again, I add bold emphasis, but my question to the black liberation movement that's kind of jumping into this communism, this socialism, wasn't Marx white? I think Marx was white. I think Trotsky was white. I think the Bolsheviks were white. I don't know. Just saying. I don't know. But here's the thing. Here's communists and Marxists complaining that the pro-communists and Marxists that are celebrating these people aren't rolling into the celebration the whole queer thing, the whole queer involvement, the whole gay, lesbian, bisexual thing, right? See, also expert witness testimony of the George Floyd case. So I'm going to come back to Pierre Kory on this. We've got a little bit of history and a little bit of understanding and what the philosophies that are being pushed here, and not just the philosophies being pushed and supported by Pierre Kory's redo of medical examiners on the George Floyd case, but how he's saying it in his own words is and the bolster that the whole revolution is getting from it, wittingly or unwittingly, from Pierre Kory's point. And in 2022, Pierre Kory put out another article. This one right here. Expert witness testimony of George Floyd murder case. He put this out in 2022. We had 2 years went by. I don't know. I never knew that. Until, I don't know, within the past few months, 6 months or whatever. I have a clear memory from early June 2020 when I was mowing my lawn on a beautiful Saturday. I had just gotten back from running my old ICU in Lower Manhattan, working 60-plus hours a week while trying to write and publish my first papers on COVID. Anybody ever seen any pictures of him down in New York City during that time? I don't know. The phone rang. Would I be willing to maintain strict confidentiality? Interesting. Am I able to produce a comprehensive report within 10 days? I had just resigned from University of Wisconsin. I had just finished my stint in New York and thus was unemployed, sort of. The FLCCC consumed all my time. But the answer was yes. The next one was what got me. Do you have or have you had any conflicts of interest with the Minneapolis Police Department? I knew immediately it was George Floyd. The protests were in full swing across the country. Whoa. Why are they calling me about George Floyd? His was not a medical malpractice case. After she determined that I had no conflict and promised strict confidentiality in a rapid review of the case. In a rapid review of the case, she confirmed that it was the case of Mr. Floyd. Whoa. Within hours, I was being interviewed by a team of lawyers on a Zoom call, and the next day they called me to tell me that they had selected me to review the case as an expert medical witness. But isn't that what happens when you give them what they want, right? When you're telling them what they want to hear, right? The next 10 days were somewhat of a blur as I spent many hours producing my report. I first had to read articles about the insanely racist and destructive behaviors of the Minneapolis Police Department. This section that I got in blue here, I'm going to read it to you again. Okay? I first had to read articles about the insanely racist and destructive behaviors of the Minneapolis Police Department, actions which had been carefully documented over the past 100 years, decades and decades of incomprehensibly cruel and concerted actions against blacks. Now, hearing that from the perspective of the revolutionary vanguard, from the people pushing the critical theory, from people pushing the critical race theory, from the revolutionary socialist, communist, anarchist perspective that has targeted our republic for destruction, the disparate impact, the structural racism, white supremacy, whiteness, accusatory perspective. Are you not going to get a bolster out of this? Are you not going to get a big push out of this, right? I first had to read articles. Okay, what articles? Who wrote the articles? From what perspective? Again, he's a doctor. He's been through academia. He's a full-blown progressive, right? Been through the freaking dip. So he's already got a collectivist eye, collectivist ear, and collectivist mindset through which to understand and comprehend everything he's seeing through his collectivist eyes and hearing through his collectivist ears. I got a little thing down here that I'm going to get to. I also had to do a deep dive into the training manuals and appropriate and inappropriate use of force by police. So, yeah, when you're in law enforcement, you get use of force training. So he had to do a deep dive into it, you know. Then I had to learn all about the science and case histories of the use of prone restraint. It is a disturbing history and considered a never event. Now, Dr. Pierre Kory uses that phrase, considered supposed to be a never event. Supposed to be a never event. He uses the same thing when he was calling for those public-private partnerships at Senator Johnson's meeting. I don't know if it was actually in that video clip that you heard, but yeah, he uses it often. It is a disturbing history and considered a never event. And this was before I started to watch the many videos collected from various bystanders. So he was watching videos from the bystanders. My report is below. It's really a rough read. It was a medical malpractice case. It was not a medical malpractice case. It was a murder. But it was from the knee, but it wasn't from the knee on the neck. Like the response to the COVID pandemic, I think it's important that we understand exactly what happened to Mr. Floyd so that it can never happen again. but it wasn't just from the knee on his neck. But anyways, I got this star up here about where he's going here. He says, I first had to read articles about the insanely racist and destructive behaviors of the Minneapolis Police Department. Now, what information did they give him to read? Is he reading objective information, or is he reading information that's pushing the narrative like we just saw from these other articles from the critical race theory perspective, which is like 99% or 99.9% of all the articles that are coming out of academia? But is it objective? That's my only question. The actions which had been carefully documented over 100 years. They've been being documented for years, okay? There's been timelines. So I just wanted to ask, compiled by who, for what purpose? For your standard run-of-the-mill progressive academic, leftist, revolutionary, collectivist, critical theory, and communist manifesto-based oppressor versus oppressed context, Wikipedia narrative. Let's go to Wikipedia and see what they have, right? You go to Wikipedia and you get the timeline of race relations and policing in Minneapolis, Minnesota. Okay? You're going to go read down through here and you get the same progressive critical theory, critical race theory based perspective. Then see the sources. The sources that, Wikipedia actually uses. You go down through here and all these different sources, right? You go down through here and you go down through this freaking timeline and they're telling you all kinds of stuff that happened and everything. All right, you go down into these sources and you look at these sources and you find one that's an objective source. You find one source that isn't from a leftist perspective unless they're trying to point something out from something other in particular. But right off the top, they got this enough is enough. 100-year, enough is enough. Minneapolis Police Department 150. So it's MD 150. Enough is enough. And this is the source. The source that's right off the top that they're showing. Okay, this is it right here. Okay, it's pretty lengthy. Document. But I see the sources and the few to no sources that aren't full-blown prison and or police abolitionists. They're not from full-blown police abolitionist organizations or prison abolitionist, abolish all prisons organizations, which is anarchism, by the way. Or as it were, outright doctrinaire, abolish all prisons, as anarchist Emma Goldman put it in her anarchist essays. Anarchists, including from the top of the long list of revolutionary sources, MPD 150's Enough is Enough, produced in its own words, to quote, to inspire and support community initiatives that contribute to a shared vision of a police-free future. A police-free future. Now, that's straight out of radical anarchist communist doctrine. These people who are prison abolitionists, anarchists, the law. I mean, all you got to do is read Pierre Kropkin. All you got to do is read Michael Bakunin, or Prodhan's another one too. But Emma Goldman's, it's all the same revolutionary collectivist stuff against the whole system of law, going back into the 1800s, right? Early 1800s in some cases. And this document itself in particular uses a source in that, Wikipedia frickin' history timeline of the Minneapolis Police Department. They wrote it to inspire and support community initiatives that contribute to a shared vision of a police-free state. The U.S. police system, we contend, is not reformable. It's structural racism, inherent racism. Like I said, it can't be fixed. It's not reformable. Reforms can provide only limited relief. So reforms aren't communist enough. They aren't revolutionary anarchist enough. They aren't postmodern enough. The Minneapolis Police Department was built on violence, corruption, and white supremacy. You see what I'm saying? This is what I'm getting at. This isn't me saying that this is what all this shit's based on. This is the people pushing this whole narrative are saying what it is. That Wikipedia used to push the main narrative out there to the people in the timeline of what the racism of, the inherent racism the Minneapolis Police Department in particular was, right? Just want to point this shit out to you. To close on this, to bring this kind of this whole thing to a close, I wanted to read you a quote from an infamous Ithaca College professor, and also an associate with a Cornell prison education program, as a longtime anti-American and fellow prison abolitionist. Her name is Paula Ionide. I think that's how you say her name. Yeah, I've got a lot more stuff on her, but this is kind of just brings it home here. What this abolition? She's an abolitionist, prison abolition anarchists. What then was? Oh, this is the article here. I wanted to show. What the hell? Get back here. I think this is it right here. This is the article that she wrote. There's Paulo Ionide. Okay, The Alchemy of Race and Effect. And she wrote this. I don't know. I think it was like 2014 or something that she actually wrote this. But anyway, The Alchemy of Race and Effect, Temple University Press Journals. Yeah, spring of 2014 issue of, I don't know, The Radical Teacher was another thing that these guys used to write. It was another magazine, an anarchist magazine that they used to write in. But anyway, this article. What then was the public secret that ruptured, the effective and intellectual epistemology of white ignorance that had encumbered and disoriented me for so long? Simply, it was American history. Now, you got to remember, this is a professor from Ithaca University, Ithaca, New York, where Cornell University is also in Ithaca, working with the prison education program, coming into prisons, teaching the inmates all this critical theory, critical race theory, which is basically you can never really be emancipated until you burn the system down. The system's got to come down, man. The prison education system, the prison system, which is supposed to be on rehabilitation to get these people back to becoming productive members of society. But why are they going to want to become productive members of society when there's a society, this whiteness, structurally racist white society that they're being told it is, has segregated them in the new Jim Crow of the prison industrial complex, criminalized them because of their race and creed and color or whatever, right? Or sexual orientation. Why are they going to want to become productive members of a society that has criminalized them? It doesn't work. It doesn't work. Yet, New York State government has been pushing and allowing these people to come into our prisons and teach the inmates this shit for going on probably a decade and a half to 2 decades now. Yeah. And that whole HALT legislation that the corrections officers were pushing back, that same world socialism, it comes out of the same world socialism that this whole critical race theory does. World socialism, world communism, same thing, right? A world philosophy collectivism, a global collectivism, and that's what communism is versus nationalism, right? But that's what they were pushing back against when they were pushing against the HALT legislation. But, you know, Hochul, the New York State government, is so entrenched into the revolution. They are so committed as vanguards of this collectivism, this world collectivist revolution, that there was no way they were going to back down on that HALT legislation whatsoever. They want to redo the culture of law enforcement and our correctional facilities. And 2,000 officers, as it stands now anyway, some 2,000 officers paid the price with their careers. She came down hard on them, and they were pushing back against that. And the price they paid, the price that the officers paid, was some 2,000 of them. It cost them their careers. Don't dare push back on the revolution when the state governors and government officials are actually the main agents of it. And that's what happened in New York. That's what's happening in New York and happening all across our country. Right? Buried beneath this college professor. Buried beneath the U.S. discourse of hard work, individualism, freedom, merit, exceptionalism, volunteerism, color blindness, and liberal democracy were mountains of systemic favors, laws, policies, and institutional structures that carefully guarded and reproduced the physiological, economic, civil, social, and cultural wages of whiteness. I'm not making this shit up, right? The evidence of race and gender-based denigration, discrimination, and exclusion versus inclusion, right? Enacted by white Americans and those who saw inclusion in whiteness was overwhelming. At every historical turn since the colonial settlers made violent contact through the various shifts and eras of indigenous genocide, slavery, Western conquest, forced removal, Asian exclusion, Jim Crow, imperialism, Northern industrialism, and post-civil rights, white people's wealth, access, opportunity, education, and life had been manufactured and protected at the uneven expense of people of color. You think she likes America? The more I learned about American history, the more I lost the coordinates of my identity, which is the U.S. in the U.S. context turned out to be overwhelmingly predicated on historical lies, unearned advantages, immoral acts, forgeries and fantasies, land appropriation, genocide, slavery, rape, privileges exhumed from others' labor, privileges exhumed from others' labor, suffering and death. The greatest lie whiteness had produced was also the most important coordinate in its identity formation. The fixed star, I've seen this fixed star thing so many other places, of racial difference anchored in the coordinates of whiteness as blackness served as the immovable pillar whose fixity was consistently and vehemently produced over time. Its fixity grounded in the originary notion of whiteness as property. Hit on capitalism there, and the whole concept of private property, which is what a communist, anarchist would do, right? The public secret, so endemically marked by systemic gender-specific racism, crisscrossed with the insatiable appetites of capitalism, revealed to me that we were actively engaged in reproducing national and global structures that engendered profound forms of human alienation. Think she likes America? And that whole alienation thing there, the atomization of society, the alienation of the individuals. Individualism is an alienation from the collective. It's an atomization from the collective, which Matthias Desmond's whole psychology of totalitarianism and the whole mass formation shit is based on. So you can take this whole philosophy right here that's being pushed all through medical freedom Dr. Pierre Kory is pushing, medical freedom academic Matthias Desmond, Malone's buddy, is pushing the same shit with his freaking book. And I did a whole show on that, deciphering the collectivism of Matthias Desmond's psychology of totalitarianism. Sorry. Check the show out. You know what I mean? In which, as a noteworthy observation, America's whiteness, heteropatriarchal or otherwise, is mentioned some 44 times in that article, and America's white supremacy is mentioned at least 10 times. When Dr. Pierre Kory, medical freedom doctor Pierre Kory, wittingly or unwittingly, there's a lot more that he's bolstering here than just George Floyd's family, wanting to overturn a previous medical examiner's report. And you can see, Kory himself up here. I mean, when his lawyers the family's lawyers briefed him, he himself says right in here, the first thing I had to read was articles about the insanely racist and destructive behaviors of Minneapolis Police Department. Within hours, I was being interviewed by a team of lawyers on a Zoom call, and the next day they called to tell me that they had selected me for review, to review the case as a medical expert. And for the next 10 days, first had to read the articles about the insanely racist and destructive behaviors of Minneapolis Police Department, actions that had been carefully documented over the past 100 years by what organizations, like I just showed you, that are fighting for a police-free America, police-free future, prison abolitionists, pushing the whole critical race theory, the anarchist communist doctrine, like Paulo Ionide. It's all the same stuff, right? It's all the same stuff, and I'm just trying to point that out. I get into this whole subject matter a little bit deeper in several of my shows, including Cornell's Radical Prison Education Program, Inciting Revolution from the Inside was one of them. And also, I did a little series on In Defense of America. I touch on it on a lot of my shows. I touch on this on a lot of my shows because, again, the progressive wedge comes around and around and around over and over and over again. But I did Defense of America series. I did this one that you can find on Rumble. This one here. I'm also posting on YouTube now. I just started posting on YouTube. I don't know, just to post over there and see what happens, I guess. And this is the third in the series of A Defense in America, Implicit Bias Training at Odds with Officer's Oath. And I get into a lot of this critical theory, critical race theory stuff, which is all just, another aspect of the collectivist revolution that has targeted our republic and liberty for destruction. Bottom line is, there is no justification for the accusatory of any of this. Critical theory, critical race theory, really, outside revolutionary collectivist doctrine itself, its practitioners, its advocates, or its critical agents in upper academia. Yeah. Anyways, I had this information, Dr. Pierre Kory's, what is he pushing? What is the freedom in Dr. Pierre Kory's medical freedom? Because I don't see it. I don't see it. Unless, I'm not seeing it. From a liberty perspective, from a defense of our republic perspective, from a defense of individual rights and liberty of everybody, of all colors, of all creeds, of all races. I'm not seeing it. I'm not seeing it. Anyways, I hope you got something out of it. I hope anybody out there who still thinks that this medical freedom movement, quote unquote, freedom movement, has anything to do whatsoever with an effort to preserve our republic, or what's left of our republic, or an effort to resecure our natural, endowed by our Creator, individual rights and liberty, or is trying to save our children and grandchildren from the criminal enterprise of vaccines, or the scare tactic narratives of zootonic jump frickin' viruses and shit, or the whole concept that I've been learning from Dr. Jonathan Kory on the whole concept of an intramuscular injection of no matter what you're putting in there, to augment an immune system that is designed to keep shit out of you, man. Our whole body's designed to keep shit out of our body. And when you bypass that to inject shit into it, for whatever reason, really, it's a violation of nature. Nature's God, I would say. Just the thought of it, right? But anyways, hope you got something out of it. Thanks for stopping by The Liberty Perspective, and we'll see you again next time. Thank you.